All right, so day 4, like I said, we're going to go over to going over the medical response, law enforcement response, and prosecution response. We'll have a couple 15-minute breaks in between. And so, yeah, we're excited to see you guys all today. We're on day 4, and this is after today, halfway through our training. Next slide, please. Again, we just like to stop, breathe, and remind people to think about the characteristics of white supremacy and how we can interrupt those habits that everybody probably has, the perfectionism, sense of urgency. I think that perfection is one that gets me. I'm hard on myself, and when I tend to feel like I'm not doing or I'm stumbling, I feel like I get very like activated and I get, it just shut down at times. So trying to remain aware of things do not have to be perfect. Things are not always going to be on time. Things are, just all of these bullet points we've gone over plenty of times throughout our training. So here's another reminder to breathe and then let spirit lead, right? Next slide, please, Deb. Again, we talked about that we are biased supporters of anyone who has experienced violence. And so being an advocate is a way of being in the world, and we are willing to challenge harmful practices and oppression and all the other things. And as good advocates, we'll meet folks where they are at. It's our role to believe, support, and assist with that navigation. And again, we stand outside of the systems. It's our role to see those overlapping pathways and to remove those barriers for our relatives that are going through what they're going through. Advocates, we also we carry that collective experience, so we have a responsibility with that. And we have that responsibility to carry those stories and honor those stories and try to fight to make those systematic changes using those stories. Advocacy is grassroots, it's intersectional, and it includes ending the goal of ending sexual violence through societal and systematic changes. So we put those in there to set the tone, to remind us why we're here, and also so that we kind of keep an eye on, our thoughts and behaviors while we're going through this. It's not going to be perfect. We have multiple staff jumping on to help, and I love my team, our team. I love anyone that's able to jump on with us. So you might see MUSAC kind of, different staff jumping on and off as we go. So just be patient with us. Christine leads these usually, and does it so beautifully. I hope we're doing her some justice. So just sending prayers for Christine and her mom. And yes, thank you guys, everyone, for being here. Next slide, please. We do have a poll, and I'm going to pull that up just to get an idea of who has experience in here or who's kind of where everybody's at. So it's talking about forensic exam and what's your familiarity with forensic exam. So we have well-trained, familiar, not familiar. You've heard things in the community or on TV or had terrible experiences with the forensic exam process. So I'll leave it open for a little bit since we have about 100 people in here. We'll take a nap. All right. Wait a little bit longer. Okay, I'm going to share results. So it looks like we have 5 people that are well trained in forensic exam. We have 29 say that they're familiar, 24 not familiar, and 13 heard things in the community or on TV. And then we have one person that had a terrible experience. So we have a very large range. And I just I wanted to put this poll up because how better to learn but from each other. And so please feel free to jump in using chat, unmuting, raising it, however you feel comfortable. If there's any point in this training where you feel like you have some experience to share. And so we're here to encourage that, and we would appreciate that too. All right. All right, so like I said, we're going to be talking about medical response today, and Ingrid is going to lead this portion. And so with that, I'm going to hand it over to you. Thank you, everybody.
Good afternoon. Good morning. I am just getting my materials ready. I do have two screens, so if it looks like I'm not looking at if I'm not looking at you, it's because I'm looking at my other screen. My name is Ingrid Anderson. I am the National Policy Director for MUSAC, and what an honor it is to be able to work alongside Steph and Debbie. I think we also maybe have Shayla and some other folks from staff who are on with us today. As always, we have our wonderful ASL interpreters. And if folks are having any trouble accessing interpretation, the materials, etc., please unmute or drop something in the chat because we do have staff monitoring that. A little bit about myself. I do feel like it's important for me to introduce myself to you so you understand what I'm bringing into your space. It sounds like you all have created a very powerful space together over the last couple days, and by the end of this training, you'll be bonded in a new way. So to encourage vulnerability, I'll be vulnerable with you. I have been with MUSAC since May of last year. Prior to joining MUSAC, I was in direct service. I've been in direct service to victims of crime for a long time. I always forget the number of years. Maybe I'm not supposed to remember the number of years. Been in a dual DVSA program, been in campus-based advocacy programs, some grassroots community organizing, legislative advocacy work around sexual violence and reproductive rights. And the last 10 years after getting my Master of Public Administration, I worked at a child advocacy center and as part of a multidisciplinary team response, and then moved to a prosecutor's office where I was up until the spring of last year. My family comes from Standing Rock and Rosebud, and I'm originally from Minnesota. I currently live out west. I'm in Mountain Time. So Steph and I were trying to navigate that as well this morning, the time zones. So the medical response, I just, to kind of set the tone, we understand that all parts of advocacy are challenging and beautiful at the same time. And the medical response particularly can be very activating to us as advocates, and of course to the survivors, the clients, the relatives that we serve. And so I want to just make sure that folks are well resourced today. If you have your medicines, you have your water, and most of all, please engage with us as your community, because this is not an easy subject to talk about. So in this module, we be talking about the terminology to describe the procedures during the medical response to a sexual assault or sexual violence. You'll be able to understand your role as well as the roles of other folks you'll encounter during the medical response. Hopefully lend some clarity to the mandated reporting requirements. And then, as always, we'll promote that victim-centered model of care to ensure that the needs and wants of the victim survivor are met and respected. So to start off, I think that we are, Deb, we might need to move to the next slide, because So these are a little bit out of order on the materials. You want to go to the next slide as well? All right, so when we're talking about the initial contact, I think sometimes we think, oh, an ambulance is going to come to the house, or, law enforcement will be there, and, it'll be treated as like a priority one emergency medical need. And that does sometimes happen. I saw that very, very infrequently. Of course, that I think comes from the mainstream kind of what you see in the media or in TV shows, understanding of crime and criminal behavior and what it looks like to be a survivor. Typically, a first responder is going to be a friend, a family member, maybe, somebody who just happened to be at the right place or the right time. 911 operators, or communication center personnel, and will typically become involved either at the request of the survivor, or somebody who maybe observed or just had a feeling about something. And then, of course, they'll dispatch law enforcement or EMS. They may be the first to provide medical assistance to a victim, but typically the goal is to get the survivor to the appropriate medical treatment. So I think it's important first to understand that the 911 operator, their job is to dispatch, right? To take in information and to dispatch. And sometimes their response can create, secondary or tertiary trauma. A lot of times I heard from folks who said, I'm never going to call 911 ever again. The way that I was treated, or, their reaction made me feel terrible, made me feel like I shouldn't have even called, like I was bothering them. And I think it is important to recognize that everybody's role is essential to a robust response to sexual violence, and to understand that a 911 operator is not an advocate, right? Law enforcement, they are not an advocate, and even EMS may not be as well. So I think when we can talk a little bit about the difference between calling 911 and contacting law enforcement. A lot of folks, struggle to know when to call 911, like, well, I can still walk, or I'm okay, I don't need to call 911. Maybe I'll just bring myself to the hospital. Maybe a couple days go by, they reach out to your center for services. Maybe you are the first person who finds out about an assault, or an act of sexual violence. I think the beauty of an advocate response is that you're starting from relation, and you're starting from connection, and that sets everybody up for success. It allows law enforcement to be able to focus on their job. A lot of law enforcement, I don't mean to speak too broadly, but maybe other folks have had this experience, that law enforcement is not always focused on building a relationship or a connection with a survivor, and you are. And so there is beauty in that. So you may be brought in from the first minute. You may be having to catch up after all of these other folks have become involved. And I think the important thing for you to focus on at this point is to connect with the victim, connect with the survivor, understand what their needs are, and to continue to voice them. Because law enforcement is going to be asking for something else. Medical folks are going to be asking for something else. Maybe the victim's partner, or, mother or sister or friend, or maybe their employer may be asking something different of the victim. And you can offer them that safe space to have their own needs, and to be able to articulate those needs, and to have those needs met. Can go to the next slide, please, Deb. So we'll watch this brief YouTube video. I think, Deb, you have to be the one to start it. I'm sorry. You may recognize some names. some faces. If you have any reactions to it, feel free to jot a note down and we can talk about those in a minute here.
A friend and
Okay, I
very
just have to restart
that
the
friend
screen for
suggested,
one sec.
Let's go to the hospital.
Debbie, there's no sound on the video.
Can we take
Okay, I
photographs
don't
of
know how to
injuries
get the
and
sound to
my
work.
phone?
It's working now. Just pull the red bar to the beginning again.
Serve myself, my
Okay.
physical self.
Sorry.
Oh, you're good. Thank you.
We all have stories to tell in our life. Many of us have stories in our life that involve sexual assault. A 15-year-old who has been interacting with another person, but things get out of hand and things happen that she didn't want to happen. She gets sexually assaulted. Now she doesn't know what to do. She calls a friend, and very, very fortunately, that friend suggested, let's go to the hospital. When someone comes to the emergency room and they know that they were sexually assaulted, someone will be called, like me, a sexual assault nurse examiner.
They are the ones that do the thorough examination and give us the evidence also to proceed.
We take care of the whole patient. We look for injuries. And we also have a long list of things that we ask the patient's permission for. Can we do the physical exam? Can we take photographs of injuries? I think it's really empowering for people to say, I'm worth it and I'm going to take care of myself, my physical self. I would definitely encourage a patient to have an advocate be there with them during the process in the emergency room. An advocate would meet a victim at the hospital perhaps and help them through the sexual assault examination process, whether they want medications or they want to talk to law enforcement or if they want evidence collected. It's all driven by the patient. It's not an easy thing to talk about. It's not an okay thing in our society that is happening. There's a lot of people out there who care about our community members. A lot of times we think it's something we've gone through alone, and it's not. A courage of one person can change a whole community.
Thank you for that, Deb. Are we able to have the slides pulled back up?
Yes, just 1 minute and I can get them back up for you.
So what that video gives us kind of a basic shared understanding of is the way that many different people come together to create a coordinated, victim-centered response to sexual violence in the medical setting. We know that there are a lot of other parts of sexual violence, sexual assault advocacy, and of course, today we're just talking about that medical response. So you may be called to go to the emergency room or to accompany a victim to, I think some states offer an acute or a non-acute medical exam. An acute exam typically is within like that. It used to be 72 hours. I think we might have widened that window because our ability to collect evidence has increased. But that acute exam and usually a non-acute, they're going to be conducted by what's called a sexual assault nurse examiner. And you might hear them referred to as a SANE exam. You might hear them referred to as like an MFE, a medical forensic exam. And the beauty of a SANE is a SANE being a sexual assault nurse examiner is that they've already been a nurse. They already have their basic medical training, and the SANE training is on top of that, creating this very specialized medical provision, the skill set, and they are focused on two things, primarily providing excellent medical care to the survivor, the patient, and like we read, or like we heard in that video, to preserve their dignity and to allow the survivor to exercise autonomy over the process of collecting that forensic evidence. I hope that a lot of you are either familiar with your medical facilities in your area, or perhaps have visited the emergency room just to see who's there, to see maybe what an exam room looks like, to introduce yourselves, especially as advocates, so they know who you are when you show up as well. So a SANE can be a nurse, they can be a doctor or a PA, they have the specific training, they're going to collect that evidence as best they can, and they're going to start that chain of evidence, like Steph will talk about later, in coordination or collaboration with law enforcement, if the victim decides that that is what they want to have done. For example, in the state of Nebraska where I live, and I think in most other states, survivors can participate in what's called like a Jane Doe kit. And so their name is not associated with the kit. They can choose to have it preserved and then tested later, all those types of things. We can talk about that later. So the exam is typically a basic physical exam with parts of it that are specifically geared towards collecting that evidence. So whether or not there is visible external injury, whether or not the survivor is experiencing physical pain, the exam is still essential. It's an essential part of the investigation, of course, will be an essential part of the prosecution. And most importantly, it plays a critical role in helping a survivor feel like they are safe, like they are okay and healthy in their own bodies, and like they are safe to continue living. They're not at risk maybe for a disease that they may have been exposed to, those type of thing. The SANE will be able to provide expert testimony. Part of their training is on testifying, being able to do the medical exam and being able to talk about it in a way that informs and educates a jury and a prosecutor and a judge are often two different skill sets. And so their training is to help them be able to testify clearly and authoritatively about their experience, their skill set, and what they observed and did during the exam. SANEs are often ideally part of some type of multidisciplinary team response. So in some areas, that's a SART, the Sexual Assault Response Team. Here where I live, we had a multidisciplinary team for the Child Advocacy Center. If there was ever a forensic exam conducted in those investigations, and then a different MDT for adult SANEs that had been conducted. Even if they were Jane Doe kits, we still conducted that MDT review because it does help keep a rigorous standard of care and make sure that folks are not slipping through the cracks. For example, perhaps someone wants to file or have a kit done as Jane Doe, but they also want the robust sexual assault advocacy that can be offered by a community-based program, and that MDT will make sure that it happens, even if law enforcement is not part of that conversation. And should a case get to this point, the SANE will work very closely with law enforcement and with the prosecutor's office. One thing that may be helpful to understand in your programs would be to understand where the kits themselves are housed. For example, in my service area, some kits were housed at a law enforcement agency. then they would have to bring one to the hospital in order for the SANE to conduct the exam. And then once the exam was completed, it would be housed at a different law enforcement agency. So sometimes there can be some confusion about where the actual kit is. And it's called a kit because they're typically in a box. And you open it up and it has all of the kit materials inside of there. But we'll talk about that a little bit later on. Of course, there's always a challenge about understanding if you even have a SANE available. Some more rural areas, for example, where I live, we have SANEs who travel, and they have dedicated spaces in all of the clinics and hospitals in our service area. So they know when they get to a hospital, maybe a rural clinic, that there will be a room ready. There will be a room that has the equipment needed, and they can just drop in maybe after having driven, 4 or 5 hours, and be able to conduct that exam. So that's another thing to familiarize yourself with. Sometimes a survivor might say, I want an exam, but I only have like from 3 to 4 this afternoon. And you might have to say, well, due to availability, we don't have a SANE who can make it. Those types of conversations are definitely helpful
Wait,
to
3 minutes, 3 minutes, 4 minutes.
to
And a mic quit.
I think you may have already talked about the SART, that sexual assault response team. And so hopefully this just will plug into your information that you've already received about that. The SART is absolutely in a position to change both, policies and practices to coordinate that multidisciplinary response, to prioritize victim safety, offender accountability, and that victims of sexual assault receive appropriate and timely services. So I think that the SART really can serve as an incubator, kind of that safe space to have those conversations about maybe what went wrong, what did we learn from this, how can we adjust our approach, not to help the victim, to help the survivor, but maybe to ease communication with law enforcement, or to help a victim feel safer in that space. Can we go to the next slide, please, Deb? All right, so a Safe Star is a particularly selected woman who has successfully completed the intensive 40-hour Safe Star training course. Their responsibility and their function is to deliver that emergency first aid, to provide referrals for follow-up care, to educate the community, in an ongoing conversation about the harm caused by sexual violence and healing, the healing work that we can do together, and potentially to collect sexual assault forensic evidence. So there are a few tribal communities that have Safe Stars. I just want to clarify that these are not SANE. These are not SANEs. This is a different certification and qualification that may be more appropriate for your community or for a community in your service area. I think Steph is wondering if we have any Safe Stars here with us today. Are we able to go to the next slide? All right. So an essential part of the forensic exam is informed consent. So what we also heard about in that video was about the different steps of an exam. And part of a SANE's skill set is to not only explain the exam in plain language, to offer perhaps materials in a language other than English if necessary, but also to make sure that as the exam progresses, that there is informed consent. There's a visual exam, to see if there are injuries that need to be documented, perhaps by photograph. There's the removal of clothes or the collection of physical evidence. So part of what we'll talk about in the exam is in the kit, you'll see there's like a large piece of it kind of looks like the paper that goes over the table at the doctor's office. And typically the survivor is asked to stand on that while they remove their clothing or anything that they have on, perhaps even shake out their hair so that any loose fibers or perhaps discarded items can just fall onto that piece of paper and can be collected. So while that might feel like, an easy entry point to an exam, it's important for a survivor to understand what's happening. Why do I have to stand right here and do, this? Of course, progressing to the more invasive, for lack of a better word, parts of the exam. Some survivors might feel comfortable with that, but do not want to have external injuries swabbed. So it's important for you as an advocate also to be listening during the exam, if you're welcomed in the room during the exam, to make sure that that informed consent is happening. So there's the consent for medical evaluation and treatment. I think we're all accustomed to signing that paperwork when we go into the clinic or the hospital, maybe even to like a chiropractor. You're always getting the updated HIPAA forms. And then there is the consent process for the specific forensic exam and evidence collection. In order for it to be true informed consent, which is the standard, the victim must understand the full nature of their consent to all procedures. So what the exam involves, potential side effects, and the potential impact. So while there may be some pharmaceuticals offered or administered as part of the exam, some folks do not want to take those pharmaceuticals. They just want the physical evidence collected. But of course, all of that is at the determination of the victim, of the survivor, and we support that. Can go to the next slide, please. So as I discussed, informed consent is needed for the following. Of course, general medical care, that pregnancy testing and prophylaxis for STIs, for HIV, permission to recontact the patient for medical purposes, and then the release of medical information. And that recontacting the patient for medical purposes might be, hey, your labs came back and, this is the result. Or, hey, we need to do some follow-up blood work based off of what came out, that kind of thing. And a survivor might feel like, I just want to get through this day and this exam, and I don't ever want to talk to a medical professional about it again. And that's why it's important to have these conversations. I think it also is important to talk not only about like the pharmaceutical prophylaxis, but like we talked about those side effects and what to expect as a result of those prophylaxis offerings. Next slide, please. So the consent for the exam and evidence collection is very important because it's not intuitive to those of us who are not medical professionals. I was very surprised when I learned even everything that goes into a pediatric SANE. And I'm glad that I had the training ahead of time so that I could not only manage my nervous system and my activation through the process, but that I was able to then explain and be a true support for the survivor and her family. So of course, we're talking about the consent needed for the examination and the evidence collection. There will also be photographs taken, including the colposcopic images. And that can feel, it can be very overwhelming, especially if perhaps this was used in the assault or in the violence that was perpetrated against the survivor. And so things like making sure the flash, like we're notified about the flash, right? There's going to be a flash, or here's how many photos we can expect to have taken. Here's why we have to take them. I've even seen SANEs who were able to, on the screen of the digital camera, go back through and show the survivor. Here's the photos I took. It doesn't show what you think it does, or, to have some ownership over that process. Then informed consent is needed for notification to law enforcement or other authorities, depending on the reporting requirements in your area. release of that information and evidence to law enforcement, permission to contact the patient for reasons related to the case, and then the toxicology screening. There have been, perhaps you've seen this on a medical ROI, like a release of information form, where there has to be specific consent for things like a pregnancy status or HIV/AIDS status. And that's just all part of this informed consent. So if there's ever a time when you can feel like the person I'm here to serve is not understanding what's on this paper, or they're dissociating, they're zoning out, they're not able to really understand what's happening, I think as an advocate, that's a moment when you can say, we need to pause, we need to revisit this, or just to give a buffer of time to make sure that the survivor that you're serving has the space, maybe both physical and mental, to really take in what they are consenting to. That's why I'm personally very happy that in the state of Nebraska, we do offer those Jane Doe kits, because it might be like a lower barrier to have a kit done as Jane Doe, and then to come back in, say, a week or two and say, I'm ready to put my name to this and to have it tested under this name, this case ID, etc. Next page, please. So the forensic exam is the most critical component after a sexual assault to build a case for prosecution. I think that we've all probably seen this response in the community, or maybe within our own families or within our own thinking. Well, she doesn't seem injured, or they didn't even find any evidence of penetration, though that kind of thinking or language. And I think everybody's expecting kind of a CSI response to a sexual assault, and a medical forensic exam is the perfect way to prepare a case for prosecution. I apologize. I just want to revisit. Is everybody familiar with the colposcopic image or the types of photographs that might be taken? I know we had quite a few folks who said that they were very familiar or well-trained or felt comfortable with their training about the exam. See, we have a raised hand. Go ahead.
Oh, no, I was just saying, yes, I am.
Okay. So to talk about the types of images that might be taken, a colposcope is a specific tool that it's a magnifying instrument that has high quality lights attached to it, that is used to examine the tissues of the vagina as well as the cervix. And these injuries are often overlooked because of the physiology, like it's a very vascular area, and so it can be difficult to determine an injury, a specific injury, especially after some time has passed. And so taking photographs with this specific instrument is essential. And there's a lot of funding out there to make sure that SANE programs have them, because they are very helpful in building a case. And in terms of just providing robust medical treatment. So we're not missing those injuries or missing that evidence. Other photographs that might be taken can seem very insignificant. We've probably all seen the photographs of a survivor's hands. Things like torn off nails, ripped nail beds, perhaps defensive injuries on the arms or on the hands or arms. Photographs of injuries to the face and neck, perhaps using an alternative light source. Has anyone seen those photos? If you're looking at a survivor's neck and there's appears to be nothing, and then we use an alternative light source and you can see perhaps a distinct handprint from a strangulation that may have happened as part of a sexual assault. All of those tools are really essential. And it can be difficult sometimes to access funding or to have someone who's trained enough to be able to use those instruments, but they do exist. They absolutely do exist, and there are ways to get some support in accessing those. There can even be one of the last cases I prosecuted or helped prosecute before we left the office last year was it really hinged on the injuries to her feet and to her legs because she had run quite a distance on an asphalt pavement, and we were able to show, you know, the length that she went to get away. And so we were glad that we were able to document those injuries and to show that to the jury, that injuries that happen during a lot of sexual assaults are not your typical bump and scrape and bruise. So that's why we need to be prepared to take those injuries. Have we all seen really poorly collected photographs, perhaps? Have you ever seen someone try to take a picture of a bump on a head? I mean, so challenging to take a picture of that. You can say, well, I can see that it's a huge goose egg. And then the photo looks like, you know, just the back of someone's head. So there is skill that is required. And that is why we appreciate and we value highly trained SANEs. All right, coming back to the exam. So the forensic exam, like we said, is a critical component of this. Like we talked about at the beginning, those two goals to provide that high quality medical treatment to the survivor and then to help collect that evidence. Next slide, please, Deb. Another way that the SANEs are essential to supporting a survivor as well as to building a case is when we're talking about the drug or alcohol facilitated assault. So we must consider the possibility that drugs were used to facilitate an assault, and we must screen for the suspected drug facilitated sexual assault, obtain informed consent for testing, and then collect those toxicology samples when needed. Survivors do need to give that informed consent, and it is also important to collect them because it can be difficult to explain perhaps to law enforcement or to a jury or even to a survivor themselves about, you know, why they behaved the way they did or why they maybe appeared to go along with things. They appeared to be pliant or agreeable to a situation when perhaps they themselves know that's not what I wanted, but I couldn't move my arms, or I just couldn't open my eyes all the way, or I was trying to say something and I couldn't make myself speak. I'm sure we've all heard those kind of comments. With informed consent, you can collect toxicology samples within we can collect urine within 96 hours, can collect blood within 24 hours. And if that blood alcohol determination is needed, it's essential to watch the time because of the way that our bodies metabolize different substances. So we do, while we focus on, you know, the sexual violence, sometimes the use of drugs or alcohol is secondary. So even while documenting a scene, it might go to the credibility of a survivor. If we can explain why, you know, a person was behaving a certain way, we can show, hey, the toxicology shows that this drug or this substance was in their system at the time of the alleged assault. The credibility is, I think, bolstered, which just makes sense. We as humans want evidence. Especially when we're talking about a systems-based response. Advocates sometimes have concerns about the need to collect blood samples to determine how much alcohol was ingested for fear of that backlash on victims. Sometimes it does turn into victim blaming or a tendency to discount or diminish the crime of sexual violence. And so that is another part of informed consent. Having those really frank conversations with the person, the community that you are serving. Of course, in a victim-centered approach, we do not pass judgment. We realize that alcohol is used perhaps to loosen the victim or survivor's inhibitions. It's often used as a coping mechanism, like willfully, intentionally over consuming alcohol or other substances. And as an advocate, we are responsible to keep that information confidential and just to support the survivor as requested. And as a voice for the victim, we may have to speak up on their behalf, if they appear to be too intoxicated or under the influence to give that informed consent. So of course, we're monitoring for, when folks become emotionally flooded, emotionally overwhelmed to the point where we're not able to make an informed decision about our care. We're also monitoring for perhaps lingering or acute effects of alcohol or substance use. Can we go to the next slide, please, Deb? Okay, so we can have a discussion if folks are up for it. Advocacy needs when informed consent is required to test for alcohol or drug facilitated sexual assault. So if a victim is intoxicated or high, does anybody want to talk about what rights they have, what needs they might have, and strategies you might use at those different points? I think if you want to come off mute or drop a comment in the chat, be happy to share those out.
I was thinking of the needs during the time even of informed consent, when someone is in the moment. And I think that they do need an advocate, because especially even though there is informed consent, but they're the trauma, and sometimes when you're in a at a point of crisis and you can't think clearly, or you just can't focus, or your mind's just in a million different places. So just having that extra support of maybe to remind you of your rights, or just even just having that gentle hand of support to know that you're not alone in a tough time, in a tough critical time.
I love that, Shayla. Sometimes just having someone who's not an authority figure remind us of what our rights are, help us remember what our values are, help us remember what safety is. Has anybody ever experienced white coat syndrome? They used to tell me I had that when I was pregnant, and I'd go into the doctor and my blood pressure would go way up because I was so nervous to see a medical professional. And sometimes we forget how to advocate for ourselves or how to ask questions just because we're in that environment.
Thank you, Shelley. Shelley mentioned it in the chat that if a victim is intoxicated, they will need someone to still ensure safety.
Yes.
Shelley.
And I think that reminder of safety kind of hinges on the fact that we do still face discrimination and stereotyping in the medical setting. I think we often have medical professionals who maybe are like, well, she's just intoxicated. She just needs to sleep it off. And perhaps there's an acute injury, perhaps there's an invisible injury that does need urgent medical attention, and an advocate can help to say, yes, intoxicated and still requiring and needing medical attention. I think this just continues to point to the need to focus on the needs of the victim, and understanding that racism and racist practices, still they exist. We're facing them constantly, even in the disparity of access. I was thinking about the right that we have to not be or to be taken seriously by a medical professional. Does anybody have any experience of being discounted or being maybe spoken down to as either yourself receiving medical treatment or being with a survivor who was treated disrespectfully? And oh, yeah, I see that you dropped that in the chat. And Elizabeth, did you have any skills that you employed at that time to kind of change the energy in a space or continue to be a voice for the survivor you were serving? Oh, Riley. I am so sorry that that happened. And I think that just illuminates the ignorance, right? We often see medical professionals as authority, and yet they are still ignorant in so many ways. Fantastic advocacy to request a new doctor. Fantastic. That's kind of the beauty of being an advocate, is we can take the brunt of some of that. We can we don't have to be in the crisis, but we can help to manage and to make sure that safety is still a priority. Because if the doctor is saying really again that they're not going to be providing a high level of care, right? I love to hear that. All right. Oh, yep. Yep. I always say, I'm happy to be the bad guy. Make me the bad guy. I'll run out to the nurse's station. I'll call for someone else. I don't mind piping up. It's okay to be seen as difficult when when we're in service to our community. All right, Deb, can we move on to the next page or the next slide? Okay. So part of the forensic exam, the SANE exam, will be addressing the risk of pregnancy. So there's the evaluation and then the care provided. So female or female identifying patients may fear becoming pregnant as a result of an assault. There may not be fear, but it definitely is a factor to consider. A baseline pregnancy test is usually administered according to the facility and jurisdictional policy. I have never accompanied a survivor to an exam where one has not been administered. It's just pretty standard. Part of the prophylaxis that will be offered is emergency contraception, sometimes called the morning after pill, or another combination of pharmaceuticals. So healthcare providers will address this issue by offering that there is that window of time that they're going to be making sure that it's administered within the 72 hours. And advocacy in this situation, I think, really hinges on that relationship and your ability to have the conversation. So we can discuss the probability or the possibility of pregnancy with the survivor we're serving. Considering if the perpetrator is a relative, what their relationship is with the survivor, and how do those relationships impact a decision, because they do. That's really an important part of our advocacy. A medical professional might not be able to help a survivor navigate that conversation, but those are certainly factors to consider. And then understanding what the community's clinic or hospital might offer as an alternative to prevent the pregnancy, offering other pharmaceuticals, etc. So I think it is important to talk about emergency contraception, how it will be administered, and then what the follow-up medical care looks like. Some folks are surprised at what the body's response is to taking emergency contraception. And just like with any drug, any pharmaceutical that we consume, it's good to understand the side effects, the risks, and the benefits. Next slide, please. Another prophylaxis that will be discussed will be for STIs and STDs. Those infections and diseases typically transmitted through sexual contact. course, hepatitis B, gonorrhea, syphilis, herpes, chlamydia, genital warts, BV, etc. So the advocacy skills in this at this part of the exam are very similar. Talking about the right to know. So like with a pregnancy test, you the right to know if you're pregnant, the right to know what diseases or infections may have been contracted. And to make sure that there is an understanding, that the survivor has an understanding that there are immediate and effective treatments available. I think sometimes there's just kind of this understanding in our society at large that, oh, they just have this STD or they just have this STI. But there are remedies available. And especially if we're able to respond medically within a short window of time after the sexual assault, there's a greater likelihood that the pharmaceutical remedies will be able to assist. And of course, to remind the survivor that there is typically follow-up testing, follow-up medical care, maybe prescription refills that will happen as a part of their medical treatment. So when we talked initially about that informed consent for follow-up communication with the medical provider, this might be part of that. To say, hey, in order for this to help you the most, we need to be able to contact you in, say 8 weeks or 3 months, that type of thing. And next slide, please. Everybody is always worried about who pays. Has anybody had an experience where a survivor froze or said that they did not want to have an exam because of the concern about payment? I mean, I absolutely have. Absolutely. Yeah, Janie. And even we as advocates can sometimes be confused if there's jurisdictional issues, or perhaps if it's someone who's outside of our normal service area. That can be challenging. So it can be a barrier to a victim in reporting the crime. Hey, there's no way I can pay this medical bill. I'm not going in to talk to the hospital about this. But we know that in a time of crisis, this is the last thing a survivor should have to be worried about. So states are required by law to ensure that sexual assault victims can receive forensic medical exams or SANEs free of charge, regardless of their decision to make a police report or not. And so if law enforcement is putting any kind of strings, attaching any kind of strings to an exam, just make sure that you are clear on your understanding of that law. If the local facility tries to charge a victim for these services, advocacy will certainly need to happen to ensure that the victim does not have to pay. And that can be something you might have in your own policies and procedures internally about, hey, we know how to advocate during the SANE exam. We don't know how to advocate with hospital billing, because that's a beast unto itself sometimes. Under Minnesota law, the costs incurred for this SANE exam are paid for by the county where the assault occurred. And the county can seek reimbursement from the victim's insurance only if authorized to do so by the victim. It's not automatic. And the costs covered by the county include, but are not limited to, the full cost of the kit, pregnancy test or prophylaxis, testing related to STI, STD status, and it's typically a little bit more expansive than that, but those pharmaceutical prophylaxes as well. All right. Looks like we have...
I'm sorry, really quick, Ingrid, in the chat wanted to mention something, Darcy?
Yeah,
Darcy?
go ahead.
Hi, can you hear me?
Yeah.
Okay. I wanted to mention, like I am the one that usually would do the sexual assault here in Winnebago. And now, there's more people on our team and they're doing it as well. But we came into, I was working with the police department. I switched over from domestic to the police department. And at the time, I took on the case. It was a high profile case. And when our advocate showed up to take her down to go get the SANE kit done, the doctor kept saying, you know, are you sure you want to do this? Are you sure you want to do this? And kept trying to talk her out of it instead of trying to help her. Like, he didn't want to do the test and work with the nurse to do that SANE kit. And that was the first time I ever ran into anything like that before. And I was just wondering, just because we went to a new facility and she was Native American, you know what I mean? Like, thinking he must have a stereotype on her, but it just really upset me because we were trying to make her, you know, we had everything for her, all she needed, you know, to go through this, because this is what she wanted. And then he went in there like 6 times and said that, you know, you don't have to do this. If you don't want to do it, you don't have to do this, and just kept talking her out of it. And finally she did, and we just wound up leaving. I don't know, I just wanted to throw that out there, like, we were trying to help her, you know, and it's still her decision and stuff, but I just that was the first time I ever came across of the doctor and the SANE nurse doing this.
It sounds like a very odd situation, especially if, like you said, it was a high profile case, because there's a fine line between informed consent, you know, a doctor and a SANE really wanting the survivor, the victim, to say, like, yes, I want this. And at what point does it become obvious that they're trying to talk her out of it?
Yeah, it
Really
was just
sorry to hear
so
that
weird.
happen. Super weird. Thank you for sharing that, Dorsey. I think it's important to talk about the different dynamics that appear when we're accompanying or observing this exam go on. I think at this point, we're going to take our break. I think about 10 minutes. I apologize. We were just a little bit behind in jumping on this break. Steph, am I correct in that?
That's correct.
Okay, so I show that it's 1:04 Mountain Time, 2:04 Central. So we'll come back at about 1:14 or 2:14. Thanks everyone for being here and engaging. Jessica, you're totally right. Those relationships matter, especially in small towns.
Thank you for putting that in the chat, Shayla. I've seen Dialina just came in. So Dialina, we're taking a 10-minute break. So we'll be back at 2:15.
Okay, as we're coming back together, I think Justin has a question in the chat. So does Winnie. If anyone wants to pop in there and offer some insight. All right, Deb, can we move to the next slide, please? I think our next slide should be about HIPAA. Okay. So I know we are discussed earlier in your training about confidentiality and what your internal practices as an organization and policies might be about confidentiality. I think we're probably all familiar with HIPAA as consumers of medical treatment. So what we need to remember is that victims do have a right to privacy and confidentiality, and medical facilities are bound by HIPAA regulations and therefore must take steps to enforce privacy protections. Sometimes victims or survivors might feel like they don't want to bother anyone, or they don't want to go to the hospital and, then have to wait for an advocate to show up. But hospitals can contact advocates directly without giving identifying details about the survivor and what they may have experienced. Victims do have a right to access their own medical records, and I think electronic medical records have made it easier than ever to access those records and to be able to review them. I think it can give a sense of ownership and autonomy over what is a very invasive process and a very stressful time in one's life. So that might be something that you can discuss as a program, how you're going to help the survivors and communities you serve access those. Of course, in small rural settings, which is where most of us, I think, probably work and live, it does feel like everyone knows each other, but it's good to remind both the people that we serve and the staff that we may encounter at medical facilities that, HIPAA does still apply. And there's a parallel law for IHS. So it's on tribal lands and personnel within IHS that facilities must adhere to privacy protection. So if that ever becomes an issue, sure, just reach out and you should be able to access that regulation. Next slide, please. So advocates, of course, understand that medical facilities must adhere to HIPAA, and we should expect that that authorization form has been completed. It is also helpful to understand the role of a release of information and how that can help you perhaps advocate and help your client better understand the process as medical professionals work to collaborate and communicate efficiently with law enforcement, perhaps with the advocate, etc. Of course, the HIPAA does not apply to community-based advocacy programs. We already talked about your internal policies and procedures around confidentiality, but you should still be familiar with this. And if the survivor has not been given that HIPAA form to fill out, you can speak up on their behalf and make sure that it has been reviewed and completed. I think we've all had those clipboards, right? We're trying to fill them out and make sure we still understand what it says before we put our signature on something. And most advocacy programs are community-based and work outside those other systems, but some advocacy programs are located within those systems, and HIPAA does apply if your system is located, if it's a health plan, a healthcare provider, a healthcare clearinghouse, a business associate of a covered entity. And all of those practitioners would then need that signed consent form. I think here in Nebraska, at least one of our child advocacy centers is housed within a hospital. And so they do have different confidentiality regulations. So it's just good to understand what you're getting into so that you can best advocate for the survivors you're serving. Next slide, please, Deb. So just a review of those confidentiality safeguards. Again, we're talking about informed consent, and that it must be adhered to by law, and that it does help support safety and a safe environment for survivors, but it also protects those first responders that we talked about, who might have been the first ones to respond or encounter the survivor that you're serving. It's one safeguard that protects the rights and confidentiality of victims because it protects victims and the various players in the medical response. And the next safeguard is HIPAA, which would protect the survivor's medical information, ideally with a release for the SART team and the patient to access those records. And as always, the survivor, the patient, does have the right to deny access to records. There is the IHS Privacy Act system of records that we already talked about. I think that might be helpful to review, even if the majority of your clientele does not engage with IHS. I think it's always good just to know in case you have to refer someone or in case someone has already accessed medical treatment there. Next slide, please. Can talk about mandated reporting now. What you need to know is that the law requires those who know or have reason to believe that there is a child who is currently in danger of being neglected or abused, or has been in the recent past, or is a danger to themselves or others, that must be immediately reported. And then you may have different internal policies about how to handle those mandated reporters. You can contact tribal or county social services where the abuse has occurred. It may not be local to you. You might just have to Google map where a certain town lies to find out which county to contact. But of course, if someone is in immediate danger, always contact 911. And even if the abuse is occurring outside of your 911 coverage area, they'll be able to transfer your call. So if past abuse is disclosed, a report must be filed to tribal or county social services. There may be law enforcement who would, remove a child from immediate danger, but you alone are required to make that report. Your advocacy program will likely must have those protocols, policies, and training around mandated reporting and what to do if you, as an advocate, believe that a child is in danger. I think it's essential that folks who enter your doors know that there is that mandatory reporting requirement in the state of Nebraska. The statute very interestingly says you're mandated reporter if you're like a doctor, a medical professional, a teacher, or any other person. So everybody in the state of Nebraska is a mandated reporter, which is pretty interesting. So it's important for you to understand the rules that apply. If anything is disclosed, if you have internal forms that are used to file that mandated report, and then to be able to understand for yourself so that you can share with the folks that you serve what will happen once a report is filed. And to have that training, perhaps even asking for some upskills on how to support both the non-offending parent and a child. And the most important thing, of course, is to protect our children. Next slide, please. Can expect, of course, to have to give your information, what your relationship is, like how you may have come in to know this information, the current location of the child, the risk of immediate danger. We talked about knowing where or possibly when an incident or ongoing incidents are occurring, a description of the child's current condition, any contact information for the child, parents, caregivers, even things like the school, maybe the daycare, anyone else who may have knowledge of the child's location or the family's situation. Next slide, please. So when we're talking about children, there is, of course, these other considerations about a minor's consent to medical treatment. So we do have our state, federal, and tribal laws that are in place to protect children. And use an advocate, you are a mandated reporter. A sexual assault examination, so a SANE of a minor may require the consent of a parent or guardian. Some jurisdictions recognize that there are situations where parental consent may not be required, such as an emergency situation or when a practitioner suspects child abuse. States or tribal agencies might also place a child on a temporary hold, in which case the state becomes a temporary guardian and thus provides consent for that treatment. All, of course, depending on the dynamics of the case. In Minnesota, as with most other states, the general rule is that a parent must be informed about and give consent for medical treatment for their child. Of course, we know that children face unique barriers if they have been sexually assaulted or abused. It's unlikely that they will be familiar with the laws that are in place to protect them. And non-offending parents or caregivers also may not be familiar with the laws or even what to do if their child has been sexually abused or assaulted. With child sexual abuse, it is most likely that the perpetrator is a family friend, a family member, somebody close to the family that typically makes it very difficult for a child to disclose. It might be a trusted community member, a spiritual leader, a teacher, or a coach. And especially in our more rural communities where a lot of us are working, these ties can be very challenging for a child to feel like they're violating if they disclose the abuse that has been going on. You should be talking internally within your programs about being clear on the costs of the exams for children, or perhaps your collaboration with a child advocacy center. Shelly, I see what you dropped in the chat. In order for us to advocate for a minor, we have to have the parents sign a permission to participate form, which allows us to advocate for the minor and the parents. Sounds like you have a robust internal process for dealing with that. Becky, I'll just read this out loud. Becky says, how do you guys handle it when a victim is, say, 15 years old and wants to get an exam, but isn't sure she wants parents to know she was raped? Do you still need parents' permission for the exam? Does anyone have anything they'd like to answer? Drop as an answer to Becky, either in the chat or out loud. So Shelley responded that they would need the parents' permission. In Washington state, a child can consent at 13. Janie says in their state, anyone over the age of 12 can seek their own medical attention. I'm so proud of you guys that you're familiar with this. I mean, unfortunately, I'm sorry that you've probably had to learn this through experience, but it is good to know. These are things that are critical to understand so you can provide the best, the most robust advocacy from the minute somebody contacts your program. Of course, there's that minor consent to medical treatment exceptions. A minor, whether sexually assaulted or not, may obtain a medical examination without contacting a parent to diagnose or treat pregnancy or an STI, STD, or a minor who was sexually assaulted or received injuries that put their life or health at risk. But as a lot of folks mentioned in the chat, it's just good to know what your state regulations are and to make sure that your programmatic policies and internal procedures are in alignment. Next slide, please, Debbie. So all of what we've talked about today gives us a lot of opportunities for change, for systems change, and for social change. So like we talked about at the beginning, these questions like, do we even have a trained forensic examiner on staff? And if we don't, how can we support finding one, training one, offering equitable pay to draw people to our community? Is there a private waiting area? How long do victims have to wait for water, medications, food, and are kits even available? So that was like what I mentioned earlier about even knowing where they are. I had I had one very bizarre experience where one of our smaller jurisdictions had a sexual assault happen, and I was at the hospital with the victim, and law enforcement, I said, hey, we'll need the kit. So they drove back to their little town and brought me the kit back. And then I said, okay, where are your evidence collection bags? Because she has the clothing on, her phone, everything. You'll want to collect this. And he just looked at me like, oh my word, what? And so he had to drive way back out to his little town. And he came back and he said, all I could find were grocery bags. So these questions are important to ask because you might be the first person who's asking them in your community. At our hospital here, the only private waiting area was like a bereavement room, and we were able to get funding to kind of redecorate it and create a really safe, comforting, soft room for survivors and their families to access while receiving SANEs at our hospital. And of course, these broader implications for social change, right? What actions can be taken to raise awareness in your community, to increase reporting rates, and to stress the importance of the forensic and medical exam? I think a lot of us have probably heard time and time again, I don't want to report because I don't want a bill for the exam. I know what kind of treatment they give people at this hospital. My friend works at the emergency room and she's always telling me who's in and out of there. All of these things that really speak to the ways that our communities betray survivors and make it difficult for advocates to do robust work. Does anybody have any insight or experience in any of those that you'd like to share? Okay. So we know that most sexual assaults do go unreported, and when they go unreported, perpetrators are not held accountable. So evidence collected through the medical exam can and will aid in prosecution. And so we encourage you to continue advocating for survivors in your community, even though the exam may be invasive, it may be a humiliating experience, for you to understand the value of the exam so that you can communicate that as a good relative to the folks that you serve. All right, Deborah, I think that should be the last slide. Maybe there's a surprise extra slide. I just see the comment that was mentioned in the chat. I really appreciate you sharing that experience. It's so disheartening. It's like that disheartening doesn't even accurately describe the feeling, right? When you find out that because of poor communication or because of folks just maybe not knowing how to do their jobs well, that our victims and survivors pay the price. Becky mentioned, I'm distressed that sexual exams aren't free of charge. Yep. And Becky, what state are you from? Remind me. Okay, in Minnesota. So in Minnesota, if you're talking about a SANE, they're paid for by the county in which the assault occurred. And then if appropriate, which it is not always appropriate, then the county can coordinate with the survivor's insurance if they have private insurance, but that's not always the case. And these are really good opportunities to advocate for change, right? To understand, hey, here's what's currently going on. This is not in the best interest of victims and survivors. And so we need to lend our voices to change not only the narrative, but the laws as they relate to serving our survivors. Well, thank you all for being in this space with me. It's been an honor to speak with you about these things. I'm handing it over to Steph. Thank you so much. And thank you, Amber and Hercules.
Thank you, Ingrid. Trying to see, should we take another break or should we just get going? We're running a little behind, and we will be taking another break in between modules after this. What is everybody thinking? Let's push on. All right, Deb, if you can share, it's like the first one that gets to the chat, I'm just like, yep, let's do it. Deb, you want to share my slides? Or our slides, but
Yeah, I was
love-
just having a glitch on my computer. It'll be up in 1 second.
okay, thank you. Yeah, so once again, we're talking about the medical response, the law enforcement response, prosecutor response, in order to kind of give everybody an overview and go in depth in some more areas of the process that the sexual assault survivor will be may have be going through. And so it's good to know your community and the services and the process, and just really being there to kind of guide the survivor through those. And so we're going to talk a little bit about law enforcement response. And I guess while Deb's getting that up, I can tell you a little bit about my experience and background. And Deb, you can start on slide 3. So I introduced myself earlier in the beginning of the training. And so I'm from South Dakota, born and raised. I grew up in the Cheyenne River Sioux tribe. And so I am a survivor, and I have gone through this, the process there. And I also have been pulled to these jobs for victim services. So I find healing in that, and I've seen where the gaps are now that I started working in my community. And there's some very scary gaps that I have witnessed, and I guess like how we said before, as an advocate, fighting to kind of fill those gaps. And I have worked in non-tribal shelters, but most of my experience is tribal on the reservation. So let's see. So I worked, like I said, in state and tribal shelters. I worked as a legal assistant for our tribal prosecutor's office, which was, brief, but the funding that we had received for that was to specifically look at and focus on sexual assault and DV. And so in the mornings we would get up, in the mornings I would go to work, and the first thing I would see is all of the arrests the night before. And so I got to see as an advocate, and I've got to see, some experience in the prosecutor's office, and kind of how everything worked together with medical. And so let's see, we're going to talk about the response today. And so our objectives, if you want to go over to the next slide. We're going to provide an overview of the primary responsibilities of tribal law enforcement, and talk a little bit about jurisdiction and then all of the challenges that come with that. And responding to a sexual assault in tribal communities. So kind of through, not through the eyes of law enforcement, but giving you a perspective of law enforcement. Most of my roles, I work closely with, especially at the prosecutor's office, with law enforcement, tribal law enforcement. And I do want to say that I haven't ever worked with state law enforcement, so I'm just coming from the tribal perspective, but we're going to go into PL 280 in these slides and then federal jurisdiction. So we're going to go through those jurisdictions. So when we're done, we should be able to understand the role of tribal law enforcement, their response, the investigation of sexual assault, including documenting evidence. And we should be able to realize the jurisdictional challenges and be able to expand that knowledge about the role of advocacy in law enforcement response. Next slide, please. So we have a short video, and Deb, on this one, if you can open it, I can too if you want, but if you are able to open it, and I know you're becoming a pro, you're going to be a pro at this by the time we're done. But there is, if you go to the marker, I think it said it on the other slide. Hold on. If you go to 9 minutes and 32, we're not going to go through, this is like a 45-minute video and we don't have time for that, but we wanted to point out some key things in this video that will help kind of relay the information. And the first one is at 9 minutes, 32 seconds, Deb.
Okay, I got it closest I could get.
Okay, thank you.
Indian reservations have a unique status.
And if you, is there any way to turn it up?
Considered
You can
sovereign
try.
nations. This means that reservations have their own governments, their own laws, and their own tribal police.
We're going out with Special Agent Wong, otherwise known as Hawkeye.
Watch the ice.
Yeah, thank you.
There's a big fight in St. Francis. All right, then 7-7, I'm going with Victor.
So we're heading to St. Francis right now, right?
Yes.
And there was a rape murder case not too long ago there, right?
I call it a homicide.
Hawkeye was one of the first officers to reach the house where 19-year-old Marquita was found.
My exact words, and I'm more kind of a straightforward person, the son of a bitch, I knew this was gonna happen. The crimes, the type of crime, it could escalate to that. And unfortunately, it did that day.
By the time we got to St. Francis, the fight was over, and those involved were long gone. It's not unusual for Hawkeye to spend the entire night arriving to calls too late.
Rusty left. Rusty do anything to you?
He does left, but I saw Patrick. It's just past midnight, one of the busiest times for tribal police. But Hawkeye is one of only 5 officers on duty, patrolling an area the size of Rhode Island.
I can't honestly say that this place is secure with 9 patrol officers and only 2 or 3 officers on duty at a time. There's no way it's secure. There's people being victimized all over that don't get reported. This place would need about 60 patrol officers and about 20 special agents.
How often do you answer sexual assault cases? Would you say?
Almost every time I go on call.
That's good, Deb. So the reason why we play that video because it really shows like the little resources that we have for many things, but law enforcement is a huge one, right? And they're supposed to be keeping people safe and, you know, responding to these all these incidents, but with particularly for my own reservation, we are 2.3 million acres, and we have, I think, like 12 law enforcement officers or something like that. And so we might typically have from 3 to 4 or 5 maybe on duty at one time. And so if you're thinking about that, like I remember being an advocate and just very frustrated. And I know that the like advocates in law enforcement often have a very the relationship can be very strained because we are there to, you know, to make sure that the process goes smoothly. And we often find a lot of hiccups and a lot of barriers when it comes to law enforcement. And really, it kind of depends on sometimes even what officers on duty, right? And so just to give you an idea of what that that video kind of displays is the very little resources that that we have, and then the challenges that will come with that. So it showed on there that the officer is responding, you know, to a community 30 minutes away. By the time he gets there, everything is gone, or everybody's gone. You know, and so he said on there, like the majority of his shift, he's responding and getting there late. And so I think that shows that we need more, we need better infrastructure in our law enforcement departments. But it also, if you think about it, is just a recipe for burnout, just like for advocates. It's a recipe for you know, just everything that we know, that high turnover rate, you know, just everything, and even the response to the victim themselves. So that is why, so for, like I said, my community is 2.3 million, or my res is 2.3 million acres. With that, and when I was working at the prosecutor's office, I got to see and try to build a relationship with that department. And so I asked them when I started my job, you know, I introduced myself and I'm like, you know, so my job was to make sure that these police reports were in and where the complaints were getting filed. And I did arraignments for Class A. For Class A, my res is DUIs and up. And so we'll get more into kind of that portion, but that's what this video was for. Let's see. So when people are calling, when, you know, I think Ingrid talked a little bit about it. They're calling in, there's a sexual assault that happened, or, you know, and so they say they decide to go, they call dispatch. That's for, you know, an emergency response, a quick response. And so I think one important thing is to know the process, and part of that would be, right, the 911 dispatch. So what is their responsibilities? Is to identify the nature of the emergency, address victim safety, they assess for what medical attention is needed, if needed, and then of course they dispatch contacts the officer. So their other responsibilities are to support that victim until the officer arrives. And we've heard the 911 calls, you know, we're trying to keep them calm throughout. And so they're sitting there in front of this screen and, you know, on the phone. And so they have multiple things going on at once. So knowing that their role also and kind of what all goes into that, I think is important. I know some people that have gone to dispatch and introduce, or some advocates that have gone in and introduced themselves so that they know, because this is also a time where they can reach out to, if they know it's a sexual assault, because they screen for that also, that's part of their responsibility. But what they can also at that point reach out to an advocate. So let's see, they gather information, the location, names of all involved, they assess for any weapons present, and then right there it says the sexual assault assessment. Sometimes they're recorded, and they also are checking for records through the database that they use. So any warrants, court orders, any weapon permits, and then, you know, any previous calls to that residence. Next slide, please. Okay, and so a little bit about the responsibilities. Oh yeah, I want to go back to 911. So I think everybody that I know that I was an advocate at the time, I was in the prosecutor's office, but there was still that disconnect between prosecutor's office and law enforcement. And so when I went in, I introduced myself. I was new. There was no, you know, I had never worked in that department before, and so I had a fresh start. And I had already like right away seen that there was a strain in between the prosecutor's office and law enforcement. And what was happening, and when I say that I was able to find these gaps and these cracks that, you know, our relatives, like their justice was falling through, was police officers were understaffed, overworked, and burnt out. And there was not, some of the police reports were not getting submitted. And then so when this was the point of view of the prosecutor's office, police officers aren't submitting they're not filing the police report. And so then when I went to go introduce myself to law enforcement, let them know my role, you know, I asked them, I'm like, okay, so, you know, trying to build that relationship to see what was going on, just assessing is really what I was doing. And they were like, well, the prosecutor doesn't file the complaint, so why should we get the, you know, police reports in? And so it's a burnt out system. It was not working. I think I don't even want to, like, I was taking data on all of everything from police report all the way to conviction. And so it was scary to see what was falling through. And all really based on this strained relationship and not having like that structured system together, and the communication. Okay, so the responsibilities of law enforcement, you know, and obviously they respond to the calls for service. They investigate the crime. They're enforcing traffic laws. They can be executing arrest warrants, serving papers, providing court security at times, conducting search and rescue operations, testifying when appropriate. And then the DNR, that Department of Natural Resources, that would be the game wardens. So even the game wardens go through law enforcement academy and have all the same trainings as a law enforcement does. Excuse me. All right, let me see if I missed anything on that one. Okay, you can go to next slide. Thank you. All right, so like I said, we were going to talk a little bit about jurisdiction because that's like the most important thing when it comes to like the justice system and who did it, who, where it happened. And so Deb, there's another video that will explain that. Do you want to go through that? It's just going to explain kind of I think it's important because it explains like the process and all of the jurisdictional, I guess, nightmares. I hear a lot of people call them that.
Okay, Steph, where is the video?
Same video.
Okay, I gotta go back. Okay.
Yep.
Okay, so I gotta stop the screen. Hold on. Okay, now I gotta go back.
Christine usually does this and she's like really quick. And I think, you
I
know,
don't
to
know.
let everybody know we are updating the module the 40 hour at this time, and that's definitely one of the things we're gonna be getting.
Okay, so what is the number? Where do I need to be?
Hold on, I had it written down. 17 minutes. And we'll
Okay.
watch about 4 minutes
Okay,
or 5 minutes of that.
okay, I got it. Hold on.
It's been 6 months since the murder of Martina's 19-year-old daughter, Marquita.
Your attorney's office,
Yes, Tim Maher.
Tim is not today. Is there someone else that can help you?
Every week, Martina phones her federally appointed attorney more than 100 miles away to inquire about the case.
Should be in tomorrow.
Tomorrow.
Mm-hmm.
Even then go to court down here, it's like 6 months down the road before you can, before you go to court for stuff, and I don't know why it takes so long.
For victims of violent crimes committed on tribal land, the pursuit of justice is often a long and arduous process, complicated by a tenuous relationship between Native American tribes and the U.S. government.
This is the border between South Dakota and the Rosebud Indian Reservation. Now, they're right next to each other, but they are a world away, especially when it comes to prosecuting rape cases. For example, if a woman is raped here in South Dakota, it's a matter for the state courts and the state police. But if I take just 2 steps, and I'm in Indian country right now on an Indian reservation, and if a woman is raped here, it's now a
Have
matter
mercy
for
in your
the
email.
federal government.
With reservations designated sovereign nations, the Indian tribes and their tribal courts have the right to enforce the rule of law on their lands, except in cases involving major crimes like rape and murder. These cases are the domain of the FBI and the federal court system.
Native American women are the most victimized group in the United States.
Brendan Johnson is the U.S. Attorney General to South Dakota. His office handles all major crimes cases sent to federal courts from the state's 9 Indian reservations.
Do you think that the Indian women trust the justice system, the federal justice system right now?
I think that there is a lot of distrust, not only with women, but, tribal community members as a whole.
Part of that distrust stems from the Fed's lack of manpower and presence on reservations.
FBI field offices are often located hours away, and there are simply too few agents to meet the demand. So despite their jurisdiction, federal authorities rely on first responders, tribal police, to begin building their cases, collecting evidence, and interviewing witnesses.
What are you on?
But as we saw firsthand, tribal police are already stretched dangerously thin.
The United States government has a legal obligation to look after tribes in terms of health, welfare, and societal being. So we rely on the federal government a lot for law enforcement funding, and it's not sufficient.
As a result, investigations suffer or simply get mired in bureaucracy as the FBI and tribal police try to work together. Victims like Donna can be forced to endure questioning by both agencies on numerous occasions.
They're keep repeating questions to me over and over. It was like, man, I just got sexually assaulted. Come on, help me here. Instead of questioning me over and over and over, you should just let it, drop it and do something about that, man.
Hey, Deb.
It's just too difficult.
The Fed's track record in Indian country is dismal. In 2006, the
Yeah,
Feds
that's good.
declined to prosecute more than 65%.
So as you can see, with all of these jurisdictions and law enforcement having to work with each other, if they do, and this is not even just, and this is just the law enforcement department, right? And so if you think about every department dealing with a lot of the same issues, it is scary, it is dangerous. And when they said that, when there's, it's, if you think about, the lack of reporting and how many people are scared to come in, that makes total sense, right? And it's, it's the advocate, it's the victim's choice if they'd like to press charges or, usually. And so I can definitely see why this system is not trusted and why a lot of people choose to not follow through. So we're going to go into a little bit, you can go to the next slide, Deb. Thank you so much. We're going to go into a little bit about jurisdiction. And so criminal jurisdiction in Indian country, and I'm going to use the term Indian country because it's a legal term. But the jurisdiction there depends on many factors. And so, hold on, are we on the right slide? Yeah, sorry, my notes are just not aligning. So it depends on including where the crime took place, like I said, the status of the offender, and the victim, and then the type of offense. The complexities of jurisdictional issues is the result of the Major Crimes Act. So let's see, jurisdiction matters. So like I said, it's necessary to determine if the crime was committed in Indian country, because that will also determine the chain of custody over evidence, and arrest and prosecution. So it can be difficult to make initial determination, but still law enforcement should make every effort to attend to the victim's safety and the medical needs, locate or apprehend the perpetrator, and of course, preserving any of that important evidence. Next slide. So what is Public Law 280? So Public Law 280 was put in place in 1953. It altered usual allocation of criminal jurisdiction in Indian country. So on reservations, which it applied to, it really just took away the federal government's authority to prosecute Indian crimes. And so the states that show right here were authorized: Alaska, California, Minnesota, Nebraska, Oregon, and Wisconsin. It authorized those states to prosecute most crimes that occurred in Indian country. There's some exceptions there. But I heard somebody talk, and like I said, I don't have a lot of experience with PL 280. So if anybody has any thing to add, or, you know, some issues that you have experienced and you're a Public 280 state, that would be, I mean, the chat is open for that, or you can turn on your mic. But I remember Christine going over it, and she said, you know, it's just this experiment that created a lot of ball dropping. And it made it very hard for the feds to step in. So does anybody have any other like input on appeal Public Law 280 state and your experience? I see that Casey said, I worked at a tribal court previously in victim assistance advocate within the prosecutor's office. Thank you, Casey.
One of the issues that we've run into here in Utah, being a mostly PL 280 state, is the size of tribes. So the only tribe in Utah, or even, you know, part of Utah, who is large enough to be able to fund and staff their own tribal police is the Navajo Nation. The other tribes here are either too small or too spread out. But because of that, they end up, you know, having to try and rely on federal assistance, but we don't even have a BIA officer stationed in Utah currently. So it creates this really big mess trying to deal with the federal government, and then local law enforcement, and then state law enforcement like sheriff's departments, and who has jurisdiction on an author reservation, and what if the person who was attacked lives on the reservation but the other person doesn't. So it's just PL 280 just created a massive mess. And has made it so a lot of people just don't access law enforcement, period. So I don't know. I am not a fan, but say that's been my experience with them in Utah.
I mean, it's even confusing for me to like try to learn it, like, you know, and so I can't imagine like trying to be an advocate. And so, I mean, we have so many, um, like as far as for us, for Eagle Butte, you know, it's tribal, we have tribal cops. State cops don't come on. We have like county, I believe, that have some sort of MOU, and then we have, city, which I believe also has an MOU. So that seems a little easier to understand to me. So it sounds confusing. Elizabeth said, from my limited perspective, it seems that there are a lot of questions among law enforcement agencies as to which agency has jurisdiction. I'm in Minnesota living on res where there is tribal law enforcement agency. Thank you.
Steph, I would like to just share that on our res in New York State, we're not a 280 res, but we fall under 280 because we're one of the original colonies or something. But I do know that the tribe is trying to get more jurisdiction and building up their court system so that the victims don't have to repeat themselves to 100 different law officers.
Thank you, Deb. And then Riley, Alaska State Troopers have had a hard time accepting DV police officers from tribal courts because they are so used to the state court forms. It's on the men, but still very annoying. Yes, there's a lot of work to be done. And I do see some progress, and I feel like it's led by advocates and, you know, our grassroots organizations and groups. And then just those people that are like willing to like just stand up, like VAWA got passed, or, you know, the reauthorization, you know, all of that's changed things. We're going to get into a little bit more of that. But there's just so much into it. I think it's very confusing. Let's see, our reservation is, Casey, our reservation is 2 states, North Dakota, South Dakota, and multiple counties. Yeah. That affects it all. It's just it's like a maze and I think in order to prepare ourselves, even though it's confusing, just think how confusing it would be to a survivor who's like, could be in shock, could be in, you know, and just the state that they're in and trying to, so this is why it's important to know this stuff and to be able to support that survivor. So it's all going to depend on your jurisdiction, who your, you know, neighboring jurisdictions, you know, what MOUs everybody has, if they have any, and kind of that process. And sometimes that might even be going and just having a meeting with law enforcement saying, hey, we need, you know, we'd like to understand this better. What is you know, and just, yeah. So I really think that hands-on and getting to know the system or getting to know your community, is really important. Candace, Red Lake is PL 280 in Minnesota. Riley, domestic violence protection orders. Yep. That's all going to depend on your jurisdiction too. What?
Oh, sorry, Steph. No, I was looking at Justin's comment when he, in the chat, when he typed, we also have tribal law enforcement on a reservation, but also fall in between multiple counties and have county cops and state patrol. But the tribal police have in first jurisdiction. I totally understand that, Justin. I live in Montana. Well, I moved back to Havre, but I was living in Missoula, and we were neighboring the Salish and Kootenai Confederated Tribes Reservation, and they are the only PL 280 reservation in Montana. We have 7 reservations, but being an advocate and serving tribal members and in respects to PL 280, the Salish and Kootenai reservation is checkerboarded, so you have some of the reservation that does belong to county and state, which is Polson, Montana. And so like getting even bounced back and forth, like, and trying to really understand the details of where the jurisdiction falls. And then sometimes just being so frustrated of being bounced back and forth. It's like, oh no, well, that's under Polson, so call Polson, and then calling Polson, and then, oh no, that's tribal. And then, you know, just getting bounced back. So really being clear about that jurisdiction piece. Thank you, Justin, for.
Right. I mean, that's why, you know, these departments need to be working together. Otherwise it's just, they're just going to pass the buck, right? They're like, that's not ours. That happens all the time. it's not our jurisdiction, and and really it's just not only is the survivor getting re-traumatized and distrusting these systems even more, but they are not receiving, if they choose to receive that type of justice or go that route, they're not receiving that. Okay, so Elizabeth, our MOU public documents, can any citizen, I don't know, honestly, does anybody have an answer to that? I don't know if MOUs are public documents. I know, that they're like a handshake between two departments. And it's not a legal binding document, but I don't know if it's public or not. I can look into it for you. Does anybody else know? Seems like it would be. All right. Sarah, thank you. This is great information. I'll talk with her. You're welcome, Sarah, and welcome on. All right, let's see. So Tribal Law and Order Act. Oh yeah, I did want to say for the other slide for PL 280, pre-contact, I'd like to mention this, that pre-contact, our tribes had our own traditional justice systems. And today, we must try to understand this like complex maze, right? I think it was a lot more simple, and it was stern. It was, set up to meet, to keep everybody safe, pre-contact from, and they, it reminded me when I read that on there, it says, we must try to understand the complex maze of justice in order to protect survivors. So I think about that and like, what are some of the things that were put in place? And for me, I know that we had whip men, and they would be the ones that enforce the rules of the tribe. And if anybody broke those, they would, have their own way of enforcing them. And so there was something in place, right? And I see some tribes, and we have the right to be making our own laws, right? So I know some tribes are implementing some traditional ways of doing and ways of handling into our tribal codes and laws. And so when I read those, I get really excited. I'm just thinking, yeah, because like obviously things are different now, but always backtracking and trying to find how our people and ancestors dealt with some of these things. I think it's beautiful in a way, and I think it's very important to kind of always keep that in mind. And so I think an example of that would be, I know there's one tribal court system that will instead of fining people that, they're putting all these fines out, and that's another thing I saw in the prosecutor's office was fines after fines after fines on like, just petty charges and that were really like a lot of or bigger charges too, and they would fine them these charges, and these are poverty-stricken areas, and they're fining people, and like what is that doing really? That's just like building up. Then they go in and bring them in for a warrant for not paying fines, and they'd sit, but like honestly, like when that tribe I was talking about, I don't know who it is, I can't remember, but I think they were instead of fines, they were putting things in place like this man had to cut wood, or this person who was charged and convicted had to cut wood for this family, this winter, things like that. I think it just doesn't make sense to me for these continued fines to be happening to like these poverty-stricken areas where, I mean, there's an 80% homeless rate too, but unemployment rate. Okay. Anyways, I'm going down a rabbit hole. So, so Tribal Law and Order Act, that's that historic legislation that recognized that domestic and sexual violence against American Indian and Alaska Native women have reached epidemic proportions. And so it acknowledges the complicated jurisdictional issues and everything that comes with that. And so the Tribal Law and Order Act ensures like it's working towards collaboration with their state and federal counterparts. Current jurisdictional scheme has a negative impact on ability to provide safety to tribes, and so has been increasingly exploited by criminals. It's not working. It requires a high degree of commitment and cooperation among tribal, federal, and state law enforcement officials. Does anybody else have anything to say about the Tribal Law and Order Act from USAC or anybody else?
I think with the Tribal Law and Order Act and the new VAWA laws that are being in place, it's giving the tribes more and more jurisdiction over what is happening to the victims in their community. And more tribes are trying to become sovereignty with their jurisdiction so that they can protect the victims on the res.
Thank you. I'm just reading chat, making sure I'm not missing anything. Okay. You can move to the next slide, Deb. I know I want to kind of get back on track with time. I don't want to keep you guys late. And so some of these areas, if I go too fast or it's not really resonating, stop me. I mean, you guys can jump in and I will not be offended by any means. Okay, so the Tribal Law and Order Act and sharing information. So this is so after hearing repeated concerns about violence in Indian country, the Tribal Law and Order Act was passed in 2010. President Obama signed the bill at a White House ceremony during which a Native women survivor gave a strong statement about the importance of legislations. Okay, so we all know that when that information is not shared and those departments aren't working together, that, like I said before, it's affecting our people. And so clarifying responsibilities and increased coordination of communication. It empowers tribal governments with authority, resources, and information necessary to provide public safety in Indian country. It reduces prevalence of violent crime in Indian country and combating sexual and domestic violence against Native women. Increase and standardize collection, criminal data, and the sharing of that criminal history information, and collecting data, crime data at a fundamental tool of law enforcement. Okay, next slide. All right, so responsibilities of law enforcement. Oh wait, we already did that. Did we? Hold on. Okay, yeah, go back one. I'm sorry, it's just a similar slide. So most law enforcement departments have protocol, an official procedure or system of rules. So they have that protocol set in place to guide our officers. And when responding to a sexual assault, it's important for advocates to become familiar and know the protocol of the law enforcement in their community. So whether that be county, federal, jurisdiction, or BIA, my tribe was BIA, and then our tribe took it over. So they're no longer BIA officers. So that responsibility is to conduct the investigation of a sexual assault, which could include interview the victim, the perpetrator, and witnesses. It also their responsibility is also to collect and transfer forensic evidence. Ingrid talked a little bit about that portion, and then also to maintain appropriate chain of evidence. It's also their responsibility to apprehend, arrest, or arrest the suspect and prepare reports for appropriate prosecuting attorneys. So there's that connection I was talking about. And participate in criminal proceedings as necessary. I would like to say the reason why I brought up my experience with law enforcement and working under a prosecutor's office is because like I said, the relationship was strained, but what I saw, since I was keeping really close data on everything and just tracking every one of those, was, I'd say over half at that time of police reports that were being submitted, they weren't what I would call, or what an attorney would call a strong police report. And so the details when making those reports and building those reports are really going to determine when the prosecutor reads, she's going to say, I can't prosecute this, or he's going to say, this is, you know, a weak police report. I'm not even going to prosecute this. And so that happens also, which is also, I believe, a result of our law enforcement being understaffed. So what I did was I went in and I tried to build that relationship with law enforcement and say, hey, I'm here to try to make sure, and I'm tracking these, you know, to make sure that if this is submitted, it's making it to the prosecutor, and then that complaint is getting filed. If it was if their law was broken. And so what I did witness from tracking them was that when people were being more held accountable, the trust was starting to mend. And so law enforcement, we saw an increase of police reports being submitted. We saw an increase of strong police reports. So while we're reading through them, the you know, the details were in there. And then we also saw an increase of complaints being filed and convictions. So okay, so did I go over that? Yep, next slide, please. So the challenges faced by law enforcement when investigating sexual assaults, our shortage of, like I said, of law enforcement officers. Sometimes they have very outdated if they have a 911 system. And then our tribal jails just are, oh my, Eagle Butte Jail is rough. So the infrastructure is not there to even hold inmates for very long, or they're small and they have a lot more inmates coming in that they can handle. So I feel like a lot of the codes, the sexual assault codes are getting stronger. But look up your codes, look up your tribal codes and see what your sexual assault tribal code is if you have one. That's another area where we can push to strengthen. Some tribes lack the infrastructure of tribal courts. So can we even take on all of that? And so patrol, oh yeah, the large geographic area, like I said, that 2.3 million acres with four people. Some of our communities are 45 minutes apart. That is scary to me. Another part that I want to talk about was I was also a state, I worked for the state also for child protection, which, you know, was a huge system that has many flaws. But I worked on our reservation, and I was the only Native social worker, and they would contract non-Native in, and the whole system, yeah. So because our tribe didn't have the infrastructure to do our own child protection department. And so that's a huge part of it, right? Do we have the infrastructure? We have limited access to advanced training on sexual assault. And then of course that complex maze. And so I want to say, like, it's so easy, just, you know, bring in trainers for law enforcement, bring in trainers for, you know, other departments. But is that training, or are those people going to be receptive to that? So I think that's a huge part. I think some are, some aren't. And I think law enforcement tend to listen to other law enforcement. So if you can find a law enforcement officer that's just, you know, really wanting to make changes and as receptive, maybe working with them might be helpful. That's some advice that I would give. And then, yeah, I know a lot of law enforcement that we did put on trainings when I was an advocate, and they just wouldn't attend. So maybe going to chief of police. I don't know. I think the best way to do it is to come at them and in any department in a respectful manner. Maybe opagi them, you know, like tobacco. Like I'm just trying to give you ideas that will mend those relationships and better that communication and respect. Next slide. And so the officer will also be collecting witness statements, you know, which can include full physical description of vehicle, addresses of suspects. So it just goes down, like these are all the details that a law enforcement officer needs to get into their police report. And so what I'm saying when I said about a week report, if you're getting rushed, it's going to be hard to get all of that in there. Also, if you know you aren't seeing them filed anyway, and I could see, you know, next slide, please. So a little bit about probable cause arrest and detention. So probable cause is when law enforcement, when they believe there's a native has committed crime of sexual assault against another Indian. So some of those departments are cross-deputized, so that other law enforcements may arrest and detain both native and non-native on behalf of that certifying agency. Tribal law enforcement officers can detain non-native for a reasonable amount of time until the appropriate state or federal law enforcement arrives. And if the tribal law enforcement can deliver also, or I mean, they can deliver also. Sometimes what I've seen was, say like a non-native was or, you know, picked up, they'll actually like drive them to the border and state will pick them up. I've seen that. It's crazy. All right, next slide. All right, so response to victim. Law enforcement's response should always be to assess safety and determine medical needs first and foremost. And then provide information on contact information for advocacy program. And so explain purpose of interview, explain purpose of gathering physical evidence. That part, in a perfect world, every police officer would be contacting if there was a DV or sexual assault incident. You know, at least contacting or giving them information. So one way I've seen other programs reach out and to law enforcement is they'll be giving them the little like pocket contact information. And so even if they don't feel like they should be calling advocates, at least trying to get them to give them that contact card so that they can give that to the survivor, the victim. Sensitive interviews and response, provide a victim with simple choices about how to interview, and then give choice of where interview will take place. So next slide. I think I already talked a lot about a police report. Like I said, all the details of it. And that just gives you an idea. And that's what this slide is the details of the names, address, phone numbers. Also what they put in there is like victim's emotional state. And they have a way of like wording that within those, you know, victim was agitated or there's many descriptive words that would make a good police report. And because all of that can be used as evidence. So also evidence seized or prepared during investigation and any unusual or suspicious behaviors of the suspect. And then information regarding the relationship between the victim and the suspect. Let's see. So yeah, they're looking for 3 things: physical evidence, a credible witness, and ideally a confession. All right, next. Oh, wait, hold on. If the officer paraphrases in the documentation, there is much that is lost in the interpretation, which can weaken the case. Police reports that clearly document details of a victim's emotional condition can be extremely helpful moving forward with criminal prosecution. All right, next slide.
Steph, can I say something really quick? I was thinking about, like, you know, when we were talking about strong reports and like the the cops being overworked and covering such large geographic areas, and maybe sometimes we only have 5 police in our tribal police department. And then I was also thinking of, like maybe there isn't always a domestic violence or sexual assault advocate available to some tribal programs due to funding, or maybe due to shifts and them not a lot of availability for emergency hours.
Mhm.
And so I was even thinking like, on my reservation, we don't have advocates available, not always after 5 p.m. or on the weekends. So sometimes police officers will try to, not necessarily, go away from their police officer role, but really trying to gather those emotional skills to be an advocate as well, like making sure that they have those side of services too. So I was
Right.
also thinking of like where they could be spread thin, where they want to offer that emotional support and try to get in contact with shelter services themselves, or, play that part on top of their police role. So I was just thinking of like, when they're trying to cover all these different spots, but then it's like, oh shoot, like maybe that could have affected the police report too. I was just thinking of like all the different
Right.
factors of what we need to work with, and
There's so many factors to like consider, so thank you for bringing that up. And I think I'm gonna run through this one very quickly. So this is like the follow-up of a sexual assault investigation. So for law enforcement officers, so establish suspect contact, interview suspect, interview victim and potential witnesses. We know like all the factors that come into people that won't provide a witness or won't provide a statement. So those are kind of some factors that go into the little thing, all the details that law enforcement has to do. Obtain search warrants, when necessary, obtain consent to search or execute, obtain copy of a 911 tape, and then writing a report. So there's a lot of stuff that goes into a report, a follow-up, and then investigation. I feel like I'm sticking up for law enforcement. It's not that. I just am trying to, I mean, I believe we all have our important roles, right? But like I said, I'm just trying to bring light to the details of on their end of it. Next slide, please. All right. So again, this is more details of that follow-up, inform victim of victim rights, provide investigators work number, encourage to call if questions arise, explaining the charging process, notify a victim when suspect has been charged. Oh, wait, hold on. These are, and then when law enforcement phase of investigation is complete, when the prosecutor's phase that's when the prosecutor's phase begins, and we're going to get into that shortly too. Let's see. If case is declined by prosecutor's office, inform victims of reason for declination, refer victim to charging attorney for further questions, remain available to charging attorney and trial attorney for any follow-up investigations. Next slide. So yeah, those kind of are all things to consider in a delayed reports. And so there I was, like the police report, like person, like trying to like track them down, and I could see why. But you know what? I'm sure it was annoying, but I was never disrespectful. It was, and I always like explained to them, like, I need to know by arraignment, like the severity and the details, because I am going to be showing up at 9 a.m. to arraign that perpetrator. And so, yeah, so it's important, but there's a lot that goes into that process. Yeah, and so we know that it's common for victims to be reluctant to report. We know the shame and stigma, we know the fear, retaliation, all of that comes in to that, and then the distrust in the system, ultimately, I believe. But that still shouldn't diminish the serious nature of the crime. And to assure victims that delayed reporting will not affect a thorough, comprehensive investigation of the crime. Next slide. So here's our review. So this slide provides information Oh gosh, my dog. Sorry. This slide provides information specific to tribal SARTs, sexual assault response teams. It in most communities in which SARTs exist, it has been generally been advocacy programs that provide the leadership in creating these teams. And so as you can see on that slide, it's really the goal to restore values of traditional community response, and then exercise tribal sovereignty by improving those tribal rape laws, tribal sexual assault laws, and then improving case outcomes and maximizing resources. And so this is ways to improve those system responses. Responders can collaborate too, and this is, what makes up a SART team and kind of what their goal is to reduce confusion over jurisdiction, improve cross-discipline communication, improve policies and practices, and response in ER, evidence collection, and prosecution. Next slide. All right, so there's a large group discussion. You can respond if you'd like in the chat or go off mute, but think about everything you have learned about the role of an advocate, and using that information that we've gone through. What is your role? Think about the investigation and the role of law enforcement too. So law enforcement has been called. A sexual assault victim has asked to have an advocate present. You arrive at the scene. So what is your role then? Simon's our little our big mascot. So reading again, law enforcement has been called. A sexual assault victim has asked you to have an advocate, or asked for an advocate to be present. So you arrive at the scene at that moment. So what is your role as an advocate?
In the chat, Mercy mentioned to introduce yourself and support the survivor. Thanks.
Yes. Thank you. Yes, very much. Like just being aware of like what's going to happen next. And so, and letting them know kind of the process so there's no surprises. Regardless how our systems are set up, they're going to be re-traumatized. But if we can eliminate or diminish some of that traumatization, I think that is the role at this point. And just, informing them. Becky said, introduce myself to victim and my role, show her I believe her. They're very good. Yes. And I want to help. Explain her rights, get her consent if she would like it. Yes. Thank you. To make sure they are believed and know what survivors' rights are and what to expect. Thank you. Advocate for the survivor and also explain to them what is going on or what's going to happen and why. Yeah. So like the most minimal surprises possible, right? Sarah, to be there 100% for the victim, but also so police. Yes, I love that you pointed that out too. Like we're really talking about, how important it is to that we can't do the law enforcement's job. And so if doing whatever we can to improve and work with that process and let the law enforcement do their job is very important. To support the victim, to listen, to say, yes, I believe I am here to help you and I will be with you through this process. You are not alone. Awesome. Thank you guys. That's all right. That's all being a good advocate. Helping the victim and secondary victims. Thank you for pointing out secondary victims, Dialina. All right, next slide. Okay, so barriers to reporting to law enforcement. We know, I feel like a lot of us know this, but there may be some new advocates in the house. So very few women receive follow-up contact either from police or from advocates after the report to the police. So they have that they have been raped. So no follow-up. Many cases hinge more on perceptions of a woman's credibility than it does on the entire set of circumstances. So we're fear just that society knowing that is a norm would keep them from reporting. Key aspects of safety and danger assessments have not been well developed in law enforcement in the response to sexual violence. Yes. All right, next slide. Okay. So here's our implications of change. And for systems change, it's that reduction of confusion over jurisdiction. We want to try to the wait time to reduced, you know, like trying to get this process, like I said, with the least re-traumatization, get them assist them, give them the information and the knowledge of what's going to happen. But they really just want to be back in, home and safe and in their environment that they're comfortable in. Improved evidence collection, improving tribal sexual assault laws. And as far as implications for change, for social change, increased trust in criminal justice system, regenerating traditional customs of community response, and then maximizing existing resources. All of that. I love this slide. It's the goal. Okay. Is that the last slide, Deb? Okay. So I hope this explained a little bit about the process. I know it might have been just a repeat for a lot of people because you work this every day, but like I said, there's some newer advocates. There's people that are just brand new to the field or, needed to hear it again. So I hope that everybody was able to take away and just as a reminder of the processes and also the importance of each department working with each other. So advocates have a role. Law enforcement has a role, medical staff has a role, but in order to really provide justice to that victim, it's not going to work unless we're all communicating and working together and having that coordinated response. So, does anybody have any questions, comments? If not, I think we should take a 15-minute break or 10. Let's take a 10 just because we are a little behind time. So let's come back at 3:52. Sound good, everybody? Thank you, ASL. This is my first sexual assault advocate training. It is the most organized training I have attended. Thank you. Thank you, Carrie. All right. Thank you for putting that in chat. See you back at 3:52, everyone.
All right, folks. This is Ingrid again. Not sure if people are back, ready to jump in for the final module of the day. Let's see. Thanks, Sarah. We just had a comment in the chat from Justin. It says, coworker said you'll have contracts with your local law enforcement agencies. Okay. All right. So in the interest of time, I'm going to get started out of respect for you and your time. I know it's been, I think today's like what, day 4, but it's still a lot and it's heavy. And I appreciate your presence as we work through this information together. So our final module will be the final module of the day, I should say, is the prosecution of sexual assault. So we'll start with maybe some shared kind of assumptions or baseline understandings to start this module. Pardon me, that we are biased to support anyone who experiences violence. So being an advocate is a way of being in the world. I think once you've been in this work for a while, you start to recognize other people who either have been doing the work or just are naturally advocates. And you can kind of start to create community, and it is a different way of being, a different way of operating in the world. We're able to meet folks where they're at, which is not a natural skill for a lot of people. And we often stand outside or in between systems. So our role, our gift is to see those overlapping pathways and to actively work to remove barriers, maybe for ourselves in our own thinking within our programs, but especially in service to our community and to survivors and victims of violence. And we carry those collective experiences to make changes at every level. And I'm sure you all have leadership, or you have engaged with maybe folks who have many more years of advocacy experience, and you can tell that they are still deeply moved by encounters they've had, stories that they've heard, things that they've seen from maybe decades prior that still inform their work. So advocacy is grassroots, intersectional, and our vision is to end sexual violence. Next slide, please, Deb. Okay, so what advocates need to know. It seems to me that there is no better way to uncover the deepest value of a culture than to observe the operation of that culture's legal system. So I kind of laughed at Steph's comment during the last module. Like, I'm not sticking up for law enforcement. But that's why I mentioned earlier that I do come from that systems. I came from the advocacy, community-based advocacy, then worked within the system for many years. And so I say that so that you can understand the lens through which I view this. But the way that we operate, the way that we do our work within the systems we're placed, declares our values. And so I believe that there are ways to hold your integrity, to hold the integrity of the community that you serve, even within systems that may seem corrupt or like they're operating contrary to our values. Next slide, please, Deb. If possible. Okay. So we'll talk about the role of a prosecutor. And the role of the prosecutor is, of course, to present the case against an offender to the court. And there's a lot of work that goes into that. By the time a case gets to a courtroom, there's been, extensive report review, teamwork, hopefully. Maybe a report has been brought to the prosecutor multiple times and they've asked for further investigation or assistance from an advocate or from maybe an in-house victim witness assistance. And so when the case comes to court, they have a duty to present the circumstances of the case and the facts, to describe the harm that was experienced. That's usually part of criminal code. To provide the court with assistance on the sentencing range, to, of course, identify and apply case law and legislation, and to do everything reasonable to ensure the court is only acting on truthful information, and to protect the court from making an error. So the ethics of being a prosecutor are critical. The prosecutor can also provide information to support the case that they've presented. And so that often includes a victim impact statement, or perhaps community impact statements, an offender's criminal history, which a prosecutor or their office would have access to, perhaps medical records, photographs of injuries, description of the injuries, that kind of thing. Deb, we are a couple slides ahead if possible.
Which slide, Ingrid, sorry.
It's okay. Can you go back to that video about a broken trust, sexual assault on tribal lands?
Yeah.
Okay, so watch this brief YouTube video. And as always, please feel free to make a note of what emotions this may evoke in you.
Fast, free, and easy way to get a logo? Vistaprint's Logo Maker. Tell us about your business. Find a design that matches your industry and customize. Color, fonts, icons, you name it. Nice. Get your logo at Vistaprint.
It's a little commercial.
That was a commercial, sorry.
This is Dave, head of marketing at a ketchup company, about to use Grammarly to handle a tight deadline. Thanks. Huh.
Sorry.
Triggers was a change in the sentencing authority of tribal courts. We got 3 years as opposed to 1. All tribes have 1 year.
I don't think
That's
this is the beginning.
If you check off all of these boxes, then we will let you sentence somebody to 3 years. A lot of tribes have just said, no, we need to be able to be independent and make our own decisions about how we want to run our court system. So thank you, but no thank you. And other tribes have had to struggle to meet all of these requirements so that they can actually exercise that 3-year sentence. And it's expensive, and so most tribes can't afford it. They have to have a court of record, which is expensive. You need a prosecutor, you need a public defender, you need a judge. There's very few Native lawyers in this country. How are you going to recruit somebody with that skill set to come out and live in a remote area that they're not from, where there's not really any housing for outsiders, and develop that infrastructure for a criminal justice system? It's just more difficult than anyone can imagine.
When the Tribal Law and Order Act took effect, I remember thinking, how are we going to do this? We didn't have any attorneys in the court system at that time. We had prosecutors, judges that had been in the system and knew the system, you know, worked in it for a long time, but we're just missing the degree. I wanted to make sure that our court was ready to move forward. Fort Peck is the only tribe right now in our region that is doing enhanced sentencing under the Tribal Law and Order Act. I went to school for my law degree specifically to come back here for my people. Sophia is 6 years old right now, and when I went to law school, she was 6 months old. I had to leave her for the first semester, basically, and hope that everybody was going to be able to take care of her in my absence. When I moved back here, I was so much more grateful for all of those things that I had missed. yeah, the resources are limited, but the biggest resource is your family and your support system. I feel fortunate that, you know, my daughters, they're not by any means afraid to speak their mind.
It's big as this living room, Mom.
Yeah. I tell them things like, you know, you're our future. You girls are going to be setting examples for other kids, and you're going to be leaders of our tribe someday. They're going to get you back to the All right. They see the news that you read with, you know, missing and murdered. And I talk about self-defense and not being afraid to speak up for yourself. I haven't sheltered them in the sense of the topics that we'll talk about. Talking about those not so comfortable things, it goes a long way.
When you have limited space and resources, you have to make hard decisions. You might say, well, let's go ahead and rely on the federal government until we have the capacity to do it on our own. But it still feels like maybe to a survivor, the tribal justice system isn't taking her case seriously.
So we hear it all the time. Well, it doesn't matter. You guys are just going to let them go. Well, that's not the officer. I mean, their jails half the time overpopulated.
Don't have a seat on the bench.
I'm sorry,
Our jail is always full. It's always at capacity. You don't have a lot of money, and if there's some people that need medical care and we're not able to pay it, then we'll put them on house arrest, and then they can pay for their own medical. Tribal jail isn't seen as a punishment. They have a bed to sleep in. They get 3 meals. They have a place to stay. You know, they're not wandering the streets, and especially when it's cold out.
If they know they're being charged or sent to tribal court, that is no sweat. They have zero fear in regards to their own court system.
The system definitely needs some improvement, but where do you start? Had I thought that it would happen a third time? Never. I had worked in the courts, so I knew it would have been hard to get a conviction in that case. It would have been he said, she said. Who's more credible? Can prosecutors prove their case? And do I want to go through and relive that for a maybe? Not after dealing with the other 2 times. It's harder now at 39 telling my story than it was at 15 because I know more things now. When the system has failed you time and time and time again, you don't feel empowered. You don't feel like you want to stand up and speak out and report people and accuse people. It feels like a disconnect between this moment of Me Too and the reality of Indian country sexual assault. A lot of Native women will look at that and kind of laugh, like that would never happen here. Even if there was a Bill Cosby here and there were 21 victims, right? It still wouldn't matter.
Sometimes the only thing more difficult than running a business is finding the right words to market.
All right, thank you so much for that, Deb. That short clip definitely paints a picture about the many ways in which prosecutors, especially in Indian country, are set up to fail or given some resources, but not really enough resources to fully address crime in our communities. And again, not standing up for anyone, not taking sides, but I think that it is important to understand the interplay between agencies and especially it might not be that a tribal judge or a tribal court is not doing everything they can. It might not be that law enforcement doesn't care, but it's always the next agency or the next step in the process that also has to be well-resourced and prepared to do their part to keep the system moving and holding offenders accountable. All right. So prosecution is, of course, a criminal proceeding in which an accused person is tried, especially those of you who may be housed in a prosecutor's office or work closely with law enforcement or a prosecutor. I do recommend having a copy of Black's Law Dictionary to be able to understand the different terms that are used and what they mean. I think we understand the possible penalties of a successful prosecution. Next slide, please. As discussed in that movie or that clip, for the federal system, the maximum time for incarceration for certain crimes can be up to life. The state of Minnesota is up to 30 years, and for tribal courts, a maximum of up to 1 year with a $5,000 fine per offense, unless the tribe is opted into TLOA, and then those sentencing maximums do increase. But of course, we need to remember that jail time is it's not the only penalty a judge can impose, and sometimes it's not the most appropriate. It doesn't, sometimes it's not even what the survivor or the victim wants to see happen. Next slide, please. So the Tribal Law and Order Act, which Steph already did an awesome job describing, allows certain tribes who have met the requirements and opted in to increase their sentencing or to expand their sentencing authority. Many tribes are already doing these things, but the process to have that authority expanded is grueling and very expensive and time consuming for tribes. Next slide, please. So TLOA also creates procedures for tribal governments in PL 280 states to request that U.S. attorneys' offices assume jurisdiction over crime on the reservation. And so these are some of the different options, which is why it's almost impossible to do a blanket description of how each tribe, each community is engaging with law enforcement and prosecution. Of course, this does not eliminate state jurisdiction, but it may be an option for some tribal governments who are not feeling like they have agency within the state system. Next slide, please. The VAWA reauthorization also expanded authority, sentencing, and jurisdiction over non-native offenders. So 18 tribes who met those requirements now have jurisdiction over non-native offenders in cases of domestic violence. There are, of course, some pretty stringent requirements that have to be met. The prosecutors, what they have to prove is more than just the criminal behavior. There has to be that established relationship that must be proven. Tribes also have quite a few requirements that they have to meet in order to exercise that jurisdiction, and it only applies to domestic violence. So it's exciting, but there's still a lot of work to do, which is the nature of our work. Next slide, please.
Ingrid, there was a quick question in the chat. Are they able to pay for court advocates for victims?
Can we pay for court advocates for victims? That's an interestingly phrased question. Can you clarify? Are you wondering if like a tribe can provide a court-based advocate? Or are you wondering if somebody's like time or mileage can be reimbursed? I'll wait for some clarification on that if you don't mind. Or if somebody else can explain what you think it might mean. Okay, so this slide just is oh, here we go. Okay, that is a very interesting question. So one thing that I will say to, so I'm blue in the face, is to remind anyone you serve, and maybe even remind yourselves, that a prosecutor does not represent a victim. So a prosecutor represents the state. So whether that is like the state of Minnesota or the United States, the prosecutor does not represent the victim. This is talking about criminal prosecution. In a civil case, which is where like two individuals would be in litigation with each other, like say Steph's huge dog ran into me and I fell and hit my head or something, then I could like sue Steph, which I mean I never would, but that that would be like a person-to-person litigation, civil litigation. But the prosecutor does not represent the victim. So even though we have victims and prosecutors must work together, there is not that legal representation. So your program could, and I'm not trying to get into like TA because I'm not sure what your funding status is, but I have seen community-based programs pay for attorneys to either like represent the victim in civil litigation, say for like medical bills or property damage, things like that. But that's not something that a prosecutor's office would engage with. Okay, so here's some of the communities that have that expanded jurisdiction over non-native offenders. It is exciting because I think for very many years, their non-native offenders knew that they essentially would not be prosecuted. And it's exciting to think that this is a foothold and hopefully things can continue to change. Next slide, please, Deb. All right, so getting into the role of the prosecutor, next slide, please. We talked about how the case will be presented. Next slide, please. We talked about that additional information that a prosecutor could present. Next slide, please. And this concept of prosecutorial discretion can just be like a real pain, especially for advocates, because there's no real explanation that we can relay back to the folks that we're serving, other than to say the prosecutor decided to not charge the case, or the prosecutor decided that this doesn't meet the felony level. All of these things that are solely up to the prosecutor's discretion. So the prosecutor, they have their own ethics, their own code of ethics that they must follow. So they must have probable cause to even file a case. And like Steph was talking about earlier, if you're getting poor quality reports or reports that appear to be incomplete or that gloss over the details, that don't give the prosecutor a good reason, probable cause, to file a case, that case is likely not going to move into prosecution. A prosecutor also can only expend resources if they're confident that they can win a case, which requires proof beyond a reasonable doubt. And while we as advocates typically operate from the mindset of we believe the victim by default, right? That is not the way that the criminal justice system works, right? We're innocent until proven guilty. And so that's really where our worlds butt up against each other. And I think it's just important to recognize that it's nothing personal, usually. Sometimes it is, but it usually isn't anything personal. It's simply that advocates and prosecutors look at the world differently, and we should. That is the nature of the work. And prosecuting attorneys also reserve the right to file a case, drop a case, make a plea bargain, proffer folks, all that kind of thing. There are notification requirements, which I highly recommend you familiarize yourself with, so that if a notification is not made, and heaven forbid, a victim or survivor ends up, getting re-injured or negatively impacted by that lack of notification, you understand what your role is in helping them with their recourse against or with a prosecutor's office. Pardon me, just need a sip of tea. Next slide, please, Debbie. So now we'll move into a description about what really happens during a criminal proceeding. Next slide, please. And of course, we all understand that we're dealing with state systems, we're dealing with the federal system, we're dealing with tribal courts. And so every journey is going to be different. We have misdemeanor cases, we have code violation cases, we have felony cases, all kinds of different cases that can be filed and handled by a prosecutor. So typically there's an arrest or a citation, which then usually requires an appearance in criminal court by the defendant. Victims or witnesses are usually subpoenaed later on for a trial, but usually don't have to be there for an initial arraignment. And that's when the charges are read out to the defendant. They are advised of their rights, typically asked if they are indigent or if they plan to hire their own attorney, represent themselves, that kind of thing. And then the case would be scheduled for further proceeding. Sometimes folks will plead guilty at an arraignment, and then the case will immediately proceed to sentencing. And in that interim, between the time of the plea and the time of sentencing, there is sometimes a pre-sentence investigation that is completed by an office serving the court, in which victim impact statements may be compiled, the victim may be interviewed, the defendant may be interviewed to assess their risk to reoffend, if they have a pro-social or a pro-criminal attitude, if they'd be successful on probation, all that kind of thing. And then move into sentencing, after which time a sentence would be served. Of course, if an individual pleads not guilty, then the case moves to trial. And if they're found not guilty, then there's an acquittal. If they're found guilty, then that sentencing, pre-sentencing process would proceed. Next slide, please. So these are some terms you may hear. This is again why I recommend having a law dictionary with you, or at least a document that you can share internally within your agency that maybe has been reviewed by your prosecutor's office and law enforcement, to make sure that you're all using the same language. I have run into this, I would say probably every single day that I worked at the prosecutor's office. Somebody would come in and say, well, I heard that he was scheduled for a change of plea, like he was changing his plea from not guilty to guilty. And really he was scheduled for a pre-trial conference. These words that sometimes lose their meaning when we are unfamiliar with the system. And so these are some words you may see, either to describe the procedure or the courtroom. Next slide, please. And there are different words that you'll see depending on what level of court the case is being heard in, and maybe just what words different agencies prefer to use to describe sexual assault. Of course, we'll see rape, sexual assault, sexual abuse, sexual battery, criminal sexual conduct or criminal sexual misconduct, indecent liberties, statutory rape, incest, date rape, and sexual violence. And I think it's important to recognize that all of these words, we can't change them because they are statutory. Like these are the laws, but we can frame them for the folks that we serve in a way that helps them understand, that what happened to them can be defined by, they can define it for themselves, but the prosecution and the courts have to use these different words in order to tell their story. So there's some nuance there, but unfortunately, there's no way to change those words in order to meet the preference of a victim or survivor. Next slide, please, Deb. So not all tribal nations have a criminal code, but our position is that there should be a statute, an enforceable statute to protect against sexual violence and to hold everyone accountable for sexual violence. Not all tribes with a criminal code have a definition of sexual assault, and many tribal sexual assault codes have been adopted and then later adapted by or from mainstream codes. Next slide, please. So of course, there's differences between aggravated sexual abuse, sexual abuse of a minor or a ward, abusive sexual contact. You'll usually see different degrees in a charging document. You'll see, like, for example, criminal sexual conduct in the first degree. And all of these codes are very important to understand because you might have a detail of the assault that the prosecutor doesn't have, or maybe law enforcement didn't know what they were hearing at the time that a victim described the assault. And you may be able to help your client, if they want to, of course, letting them lead the way, to revisit that detail that may take something from a misdemeanor to a felony. And I wish I could tell you how many times it happened. It happened very, very frequently with me. I think we all know that women, especially we as Native women, especially when we're being interviewed by men or by mainstream agencies, they're not always listening with an attentive or an attuned ear, and we're not always speaking the same language. And you can act as a conduit to help make sure that the victim's voice is heard and heard clearly. Next slide, please. So Minnesota has a statute of limitations, and this simply refers to the limit of time that a prosecutor has within which they must charge a case. So the Minnesota statute of limitation for adult victims of crime are 9 years for first, second, and third degree criminal sexual conduct, and 3 years for fourth and fifth degree criminal sexual conduct. So victims can report at any time. There's never a time limit on reporting or accessing services, but a prosecutor will simply be unable to prosecute if that time limit has passed. And these are conversations that prosecutors must have with any complaining witness or victim. And if you as an advocate are unsure about that, maybe going into like maybe bringing a client to a police department to file a report, I think that this is just something to say, like, hey, this happened several years ago. They might talk to us about the statute of limitations. Here's what that means. just to manage those expectations. I made that mistake a lot as a young advocate, wanting to go in kind of raring and ready to go, like, you're the perfect witness, we've done everything right. Of course they're going to charge it. There's no way that this is going to be a decline to prosecute. And I made a lot of bold statements that I should not have. I learned to manage my own expectations and then to help manage the expectations of my client as well. Next slide, please. So I think in the interest of time, I might just encourage you all to find a code, either a federal law or a law from your state about sexual violence and your state or your tribe, and to really parse it, to look at the words, to make sure that you understand the words, that you're familiar with the words, and maybe to circle or underline anything that you're unfamiliar with, or words that you would like a definition of, or to have a deeper conversation about. I think Steph dropped some guidance in the chat as well. Yep, here's some more information from TLPI about sexual assault as well. Okay, next slide, please, Deb. So crime victims' rights are, of course, integral to the prosecution of criminal behavior. Next slide, please. And there's a shared federal understanding about victims' rights, but in the state of Minnesota, there are three main components. There is the notification. So a lot of states have like an automated victim information sharing or victim notification system. There's the protection from harm, and then there's the participation in prosecution. For victim compensation, which sometimes is part of a crime victim's rights bill or legislation, all states have a special fund to help crime victims with financial issues relating to crime. And the federal government provides funds to each state. Of course, we understand that these funds are dwindling. They have been just pretty much decimated over the last 5 to 6 years because of the very limited deposits that are being made in the federal fund. But the state distributes those funds both to victims of federal crime and of state crime. And at least for the state of Nebraska, I will say that the requirements are pretty stringent, and there's like even a window of time and you have to report a crime in order to be eligible for the fund. So I highly recommend that you familiarize yourself with that as well. Next slide, please. And Steph, I see that we are at 4:30. Do you want me to keep going, or is it time to wrap things up?
How many more slides are left? Sorry, I was looking at these publication.
I think there's about 5 slides left that we need to talk
If
about.
you want to breeze through them.
Yep,
I'm
we'll
sorry.
breeze through.
Yep,
So
thanks.
like I talked about, there are these eligibility requirements. Next slide, please, Deb. And there's an application process. Minnesota has a 2-part form that must be completed, but each state does have its own form. Sometimes a notary is required, and so that might be something to discuss internally as well. Can we make sure we have a notary on staff to make sure that we can help folks complete these forms? In the federal system, there are 8 specific rights accorded to victims: that they be protected from the accused, that they're given notice, that there is participation, they have a right to be heard, a right to confer with the prosecutor, a right to request restitution, a right to the speedy process, and then to be treated with fairness and dignity. And there are, of course, avenues to report violations of crime victims' rights. So advocates, Deb, I'm on slide 36. Advocates and prosecutors, have that collaborative goal, but we do have separate roles. Advocate, of course, is to center the voice of the victim in the process and to work for that social and systems change. And the goal of the prosecutor is very different. It's to enforce the criminal law and to protect the community. But it's also very powerful to find those areas where we can overlap and to make sure that we're supporting each other in our work. Next slide, please. So a survivor might not want to work with law enforcement or prosecutors, and an advocate, of course, we're not there to force or to coerce anybody into doing something they don't want to do. But a lot of times sharing that information and providing really intentional wrap around support to victims can help them feel empowered to enter the criminal justice system as a victim, to enter a prosecutor's office, to know what they're doing, to know that they have support regardless of the outcome of a case. Next slide, please. There have been decades of reform to sexual assault law, and there's obviously a lot more room to go. Next, I think there's 2 more slides ahead, please. And there are some trends in updating the statutes. I think that there was a interactive slide there that we can skip, and 2 slides ahead, please, to 40. And then I think it's important to have this discussion about justice. What does it really mean? Does it mean to be safe? Does it mean to have a guilty verdict? Does it mean to just be heard? To have someone believe you? I'll just leave you with this. I said this to every single person who I asked to testify in a criminal prosecution, which is, there is absolutely nothing magical about the criminal justice system. It is not going to heal you. It is not going to bring you back your time. It's not going to unvictimize you. You still have to be committed to doing your work, and you still have to have the support around you to do that work. But if it is accessed in the context of a well-resourced relationship with your advocate, with your community, with yourself, going through a successful prosecution, whatever that means to you, can be a part of your healing. But I think a lot of it is sharing expectations and managing those between you as the advocate, the community you serve, and the prosecution law enforcement team you work with. I'll leave you with this. It seems to me there is no better way to uncover the deepest values of a culture than to observe the operation of that culture's legal system. And I'm sorry we had to breeze through the last of that there, but I appreciate your time and your presence with me this afternoon. And thank you, Angela, for being patient as we wrapped up here.
Yes, thank you so much to ASL interpreters. We appreciate you all. And we appreciate everybody staying on a little bit later, but we will see you next week, and I'll send out the slides. Have a great weekend. Thank you, Shayla. And also we will be staying on until 5 if needed. So if anybody wants to debrief, I'm gonna quit recording.